Good morning. Please be seated. Minister of Natural Resources. Okay, never mind. Call on the member for Kent South for prayers.
Prions le Seigneur, let us pray. Ô Seigneur, notre Père céleste, haut et puissant, Roi des rois, Seigneur des seigneurs, le seul souverain des princes qui contemplez de votre trône tous les habitants de la terre, nous vous supplions du fond de nos cœurs de regarder avec faveur notre très gracieux Seigneur souverain, le roi Charles, et de le remplir tellement de la grâce de votre Esprit Saint qu'il fasse toujours votre volonté et qu'il marche dans vos voies. Donnez-lui l'abondance de vos dons célestes. Donnez-lui la santé et le bonheur d'une longue vie. Fortifiez-le afin qu'il triomphe de tous ses ennemis et finalement, après cette vie, qu'il jouisse de la joie et de félicité éternelle par Jésus-Christ notre Seigneur. Amen. Most gracious God, we humbly beseech Thee, as for this province in general, so especially for the Lieutenant Governor and the Legislative Assembly, under our most religious and gracious King at this time assembled, that Thou wouldst be pleased to direct and prosper all their consultations to the advancement of Thy glory, the safety, honor, and welfare of our sovereign in this province, that all things may be so ordered and settled by their endeavors upon the best and surest foundations, that peace and happiness, truth and justice, religion and piety may be established among us for all generations. These and all other necessaries for them and for us, we humbly beg in the name and mediation of Jesus Christ, our most blessed Lord and Savior. Amen. Ensemble, prions notre Père. Together, let us pray the Lord's Prayer. Notre Père, qui es aux cieux, que ton nom soit sanctifié, que ton règne vienne, que ta volonté soit faite sur la terre comme au ciel. Donne-nous aujourd'hui notre pain de ce jour. Pardonne-nous nos offenses, comme nous pardonnons aussi à ceux qui nous ont offensés. Et ne nous laisse pas entrer en tentation, mais délivre-nous du mal. For thine is the kingdom, the power and the glory, forever and ever. Amen.
Introduction of guests. Condolences. The member for St. Croix. Oh, excuse me. Agreed. Minister of Education and Early Childhood Development.
Thank you, Mr. Speaker. It's my pleasure to welcome grade 11 and 12 students from Minto to visit us today. I talked to them in the foyer. They're interested to see how government works, and I told them that the most exciting part of the day was question period. So, welcome.
Minister of Public Safety.
If you'd like to wait till they're all in.
Thank you, Mr. Speaker. I'm pleased to echo the Minister of Education's introduction. We have the grade 12 leadership class from Minto Memorial High that's with us here today. Accompanying them is Mr. Kendall Gaddis and Vice Principal Craig Richards. We're glad to have them. We also have the Student Council for the high school. And my son's in attendance here as well. He is the co-president, Silas Austin, with Olivia Summers is here as well as co-president, Vice President Aaliyah Casey, Secretary Ashley Eit, Treasurer Alyssa Rideout, and Public Relations Hannah Malner. I ask everybody to join me in welcoming the leadership class and student council from Minto Memorial High.
Condolences. The member for St. Croix.
Mr. Speaker, I rise today in sympathy and respect to offer condolences to the family of Gilda Gibson of St. Stephen, who passed away November 23rd. Gilda was a giving person and very generous with her time. For 12 years, she voluntarily managed the gift shop at the Charlotte County Hospital and also volunteered almost daily for almost 10 years, or for more than 10 years, at the local SPCA until her retirement in 2017. She was responsible for the intake and care of kittens. Gilda was so exceptional in her SPCA duties that in 2009 she was honored by the Canadian Federation of Humane Societies for her exemplary service to the Charlotte County SPCA. Gilda was also an avid reader and especially enjoyed the history of the royal family. She had a flair for decorating, especially at Christmas time, when she was known for her beautiful Christmas trees. I ask my colleagues to join me in expressing sympathy to Gilda's husband, Wayne, her family, and to all the people and creatures who felt Gilda's love. Thank you, Mr. Speaker.
Le chef de l'opposition officielle.
Monsieur le Président, le dimanche 4 décembre 2022 est décédée Ella Légère de Boudreau-Ouest. Elle était la fille de feu Stanislas et Rosida Mélenchon-Leblanc. Elle était aussi la belle-mère de mon collègue de Chédiac-Beaubassin-Capelé, la mère de son épouse Denise, que je connais bien, et je leur offre mes plus sincères sympathies de la part de l'opposition officielle. Elle avait une grande passion pour sa famille. Elle aimait la pâtisserie, car tout le monde aimait ses chocolate chip cookies et ses biscuits à la melasse. Elle aimait le jardinage, la peinture, la couture et elle aimait particulièrement Noël. Elle laisse dans le deuil son époux bien-aimé et dévoué Edmond Légère, ses 5 enfants Jerry, Maryse, Denise Légère, Jacques Leblanc, Lise Aucoin Gary, Joanne Légère, Darren Galley et Charles, ses 5 petits-enfants Jason, Sean, Stéphane, Christelle et Annie, ses 3 arrière-petits-enfants Lennon, Olivier et Lily et plusieurs neveux et nièces. Ses 2 frères Louis, Benoît, Robert, Carmel, ainsi qu'une sœur, Yolande Thivierge, Gilles. Ses frères Roger, Clarence, Donald et sa sœur Jeannette l'ont précédé dans la tombe. Joignez-vous à moi pour offrir nos condoléances à la famille de Ella Légère.
The member for Fredericton South and leader of his party.
Mr. Speaker, I rise today to offer my condolences to the family and friends of Ruby Sloan-White, who passed away on November the 30th at the age of 102. She lived just around the corner from me in Skyline Acres here in Fredericton, and Ruby was deeply rooted in her neighborhood with family and her friends and neighbors. To say that Ruby will be missed is an understatement, Mr. Speaker. She was an inspiring, ever-strong person and a true matriarch of the Sloan-White family. She loved life and especially loved her garden. She literally could grow anything. She was ever young and never stopped. Even at the age of 102, she continued to advocate for her friends and family that she felt couldn't advocate for themselves. Ruby was predeceased by her son Brad and is survived by daughters Yvonne Mulligan, Jeanette Kenny, Lynn Sloan-White Corrigan, Susan Loverock, and Idella Sonardi, her son Daryl, her daughter-in-law Ruth Sloan-White. She's also survived by numerous grandchildren, great-grandchildren, and great-great-grandchildren, and loving nieces and nephews. I invite all members of the House to join me in extending condolences to the family and friends of Ruby Sloan-White.
The Deputy de Kent Sud.
Monsieur le Président, le dimanche 4 décembre 2022, à l'âge de 73 ans, entouré de sa famille, est décédé paisiblement Aldoria Popeye McDonald de Bouctouche. Né à Bouctouche, il était le fils de feu Camille et de feu Rita Leblanc McDonald. Aldoria travaillait à son propre compte. Il était le propriétaire de A.C. McDonald Foundation and Building Movers. Il était aussi membre du groupe AA depuis plusieurs années et était passionné de sculpture de bois. Il manquera beaucoup à ses 2 filles, Carole Leblanc, Daniel de Richibouctou-Village, Monique McDonald, Jamie de Miramichi, ses 4 petits-enfants, Julie, José, Ben et Will, ainsi que la mère de ses filles, Stella McDonald. Il laisse également dans le deuil ses 4 sœurs, Simone Béliveau, Réal, Genève Hébert, Euclide, Joanne Daigle, Feu Jean-Paul, Jasmine Lirette, Normand, tous de Bourcouche. Il est bien connu Popeye. Il était un homme coloré et bien apprécié dans la région. Sa propriété ressemble à une galerie d'art extérieure tellement ses œuvres en bois sont belles et impressionnantes. Repose en paix, cher Aldoria. Merci.
Message de félicitations et hommage, the Minister of Service, New Brunswick.
Mr. Speaker, I rise today to congratulate Chief Alan Polches Jr. on his re-election as Chief of St. Mary's First Nation. Chief Polches was elected in 2018 and became the first two-spirited chief in Atlantic Canada. He is now in his third two-year term. St. Mary's First Nation is one of the largest employers in Fredericton North and is a very important part of our economy. As MLA for Fredericton North, I've had the pleasure of working with the Chief on various issues concerning our communities. In the time I have known him, he has proven to be fair, forward-thinking, and dedicated to building a better future for our province. Wuliwan Sekum Polches for your hard work and dedication. I look forward to working with Chief Polches in the coming years and invite my fellow members to join me in congratulating him on his re-election.
Deputy Kerr.
Monsieur le Président, je suis fière de me lever en chambre aujourd'hui pour souhaiter un heureux anniversaire de naissance à Monsieur Arthur William Landry, qui a atteint l'âge vénérable de 105 ans ce 2 décembre 2022. Originaire de Saint-Paul-de-Grand'Anse, M. Landry a une feuille de route impressionnante. Ancien enseignant, il est connu comme étant l'aîné des naturalistes du Nouveau-Brunswick. D'ailleurs, il a été reconnu pour son importante contribution dans la protection du patrimoine naturel de notre province. M. Landry est également surnommé le père de l'astronomie. Comme il est né en 1917 et qu'il a commencé à s'intéresser à l'espace, aux planètes et aux galaxies à l'âge de 4 ans, ça fait donc plus de 100 ans qu'il étudie les origines de l'univers et de la vie. Il est une sommité en la matière et tout le monde le reconnaît dans le milieu astronomique de notre région. Monsieur Landry, vous êtes une inspiration pour nous tous et vous êtes définitivement notre étoile. J'invite donc tous les parlementaires à se joindre à moi pour souhaiter un heureux 105e anniversaire de naissance à Monsieur Arthur William Landry. Merci.
Statement by members. The member for Edmundston-Madawaska Centre.
Monsieur le Président, au cours des dernières années, le panier d'épicerie des citoyens de la province n'a pas arrêté d'augmenter. Maintenant, on nous annonce encore des hausses importantes pour la prochaine année. L'accès à un logement est de plus en plus difficile et le prix est un autre défi pour de nombreuses familles. Nos routes ont besoin d'investissements et non pas seulement des investissements en capital. Ils ont besoin d'être entretenus le printemps, l'été, l'automne et l'hiver. Et au contraire de la pensée du Premier ministre, l'entretien doit être fait le soir et la nuit afin que les citoyens puissent circuler en sécurité en tout temps. Les conservateurs se pètent les bretelles sur les surplus, mais c'est au détriment de l'aide et des services aux citoyens. Je peux comprendre que le taux de satisfaction maintenant des conservateurs est au plus bas. Monsieur le Président, avec le temps des fêtes, il serait le temps pour les Néo-Brunswickois de pouvoir rêver au Père Noël et de ne plus faire de cauchemars avec le Grinch.
Member for Fredericton South and Leader of his party.
Mr. Speaker, yesterday the world arrived in Montreal to negotiate targets designed to halt and reverse the degradation of nature. Habitat destruction and pollution are literally eating away at the web of life. The only way for Canada to do its share is if provincial governments across this country agree to adopt those targets, because they fall within provincial jurisdiction. Targets to substantially reduce use of pesticides like neonicotinoids and glyphosate. Targets to reduce the nutrient pollution by half that's created dead zones in our coastal bays. Targets to eliminate the release of plastic wastes into the environment. And targets to halt and reverse the decline of forest species decimated by inappropriate forest practices that continue to consume valuable habitat across this province. Mr. Speaker, we can live in harmony with nature. We must. A healthy respect for the world view of the Indigenous people of New Brunswick would be a good place to start.
The member for Ormond-Lincoln Ferryton.
Mr. Speaker, yesterday our Minister of Finance delivered our capital budget estimates for 2023-2024, and I know I speak for my colleagues when I say there was a lot of great news in there. Among all the other positives, the Minister spoke about continuing to deliver dependable health care to New Brunswickers, even in the face of rising demands on our system. Our multifaceted plan, titled Stabilizing Health Care, an Urgent Call to Action, will see this government invest over $176 million in 2023-2024. We will be expanding and renovating hospitals, creating more capacity in our clinics and facilities, buying new equipment to help our healthcare workers deliver the best care possible, and of course, recruiting more healthcare professionals to shore up our coverage of care. We have a plan, Mr. Speaker, and a great one at that. Thank you.
The Deputy to Bathurst West, Beresford.
Thank you, Mr. Speaker. Last spring, the former Minister for DTI introduced a plan to revolutionize the airline industry in this province and make us the envy of the entire country. We waited over 20 months for that report. We now have a new Minister for DTI. I trust that he's had a chance to look at this plan and confer with his staff about it. It's been 6 months since the report was tabled. Should we not be seeing some results at this point? At the very least, some communication around targets, goals, and anticipated projects? After all the noise generated from the first throne speech from the Premier, where he could barely contain his enthusiasm for transformations to come, not a word about airports in his last throne speech. Surely this industry is still on the government's radar. Some of us still believe in the potential and the importance of our provincial airports. It would be great to hear a semblance of a whisper from this government on the subject.
The Deputy to Kent North.
Monsieur le Président, pendant que le Service canadien de la faune sonne l'alarme sur le fait que plus de 650 espèces de plantes et d'animaux sont en péril au Nouveau-Brunswick, principalement causées par l'activité humaine et la perte violente d'habitat, le ministre de l'Agriculture, de l'Aquaculture et des Pêches du Nouveau-Brunswick continue de pousser agressivement son agenda mal avisé de monoculture, coupe à blanc et d'agriculture industrielle dans l'ancien champ de tir de Tracadie, au profit des grandes corporations de l'extérieur. Un développement responsable de nos ressources passe d'abord par des consultations sincères et de bonne foi avec les Premières Nations. Un développement responsable de nos ressources passe ensuite par des tables de concertation afin d'assurer que ces parcelles de terre à valeur multiple soient libres de conflits d'usage. La ministre n'écoute que l'industrie qui lui fait des promesses vides et abandonne les agriculteurs d'ici, ainsi que les citoyens et citoyennes. Pas surprenant qu'elle se fait duper. Elle en a malheureusement l'habitude.
The member for Moncton South.
Mr. Speaker, capital budget delivered yesterday is solid proof of the New Brunswick advantage, record population growth, employment hitting new highs, and the wage growth leading the country. We now have the economic momentum to build on. We are proud of our 2023-2024 capital budget, which provides increased funding to address infrastructure needs. The Department of Transportation and Infrastructure will invest $477 million for the maintenance and improvement of our highways, roads, and bridges around the province. This budget targets $33 million for affordable public housing, the first government-owned housing units to be built in 38 years. In health, a total of $176 million will help us to invest in facilities that deliver health care services. Mr. Speaker, this is a budget New Brunswick needs, and it's a budget that we can afford. Thank you.
The Deputy de Shippagan-Lemec-Nisku.
Monsieur le Président, le prix des loyers, de l'électricité, de l'essence et du panier d'épicerie ne sont que quelques exemples de la misère qui afflige les gens. Comme le Titanic, la province prend lentement l'eau. Plusieurs ministères dans la santé et l'éducation s'enfoncent de plus en plus profond. Comme les passagers sur le poids de l'eau, les gens du Nouveau-Brunswick croulent sous le poids des dettes et des factures à payer. Comme l'iceberg, le gouvernement regarde les gens du haut, inébranlable et glacial. Merci, Monsieur le Président.
The member for Memramcook-Tantramar.
Mr. Speaker, our hospitals are cracking under the strain of years of underinvestment, years of overwork and burnout, a pandemic that is still going, now an onslaught of more viruses, where public health measures have been all but abandoned. Paramedics, doctors, nurses, healthcare workers are saving lives under the most difficult of conditions, with ERs overflowing, people waiting day and night for care, 36-hour offload delays for ambulances, and patients feeling desperate and terrified that they won't get treated in time to save their lives. And Mr. Speaker, sometimes they don't. Where's the plan to address the public health crisis we face? Where's the plan to keep students and their families safe? Where's the guidance and direct communication to help us navigate this crisis and protect ourselves and each other? Where's the plan to move us out of crisis mode? Mr. Speaker, when it comes to this government, we know the answer is they will do the bare minimum or less.
The member for St. Croix.
Mr. Speaker, this government is getting the work done. With prudent budgets since forming government, we've significantly improved the province's fiscal outlook. We've reduced our net budget, and our net debt to GDP ratio is better than it's been in years. We have focused on the needs of New Brunswickers, building a stronger, more resilient province. Through targeted spending and investment, we now have more flexibility to address our infrastructure needs while dealing with record population growth and high inflation. Mr. Speaker, with capital spending of more than $1 billion, we will continue to be responsible with New Brunswickers' money. We are expanding and modernizing our healthcare and education systems, our highways, roads and bridges, and we are investing in public housing. Thank you, Mr. Speaker.
Oral questions. The Leader of the Official Opposition.
Mr. Speaker, 2 years ago, the Auditor General suggested that revisions be made to the contract signed with Medavie for delivery of services by Ambulance New Brunswick, and that if we waited until 2027 when the contract expires, that the quality of service will continue to miss targets. And we continue to see long wait times, response times, in rural communities especially, and offload delays which continue to put pressure on our crumbling healthcare system. Issues that the AG had raised include paying millions for performance targets that were actually biased against rural areas, excessive use of exemptions which are supposed to be used for circumstances beyond the control of the ambulance service, incentives to maintain low staffing, and then overall governance issues. And so the Auditor General pointed this out to assure that New Brunswickers get the best possible service they can get. The former Health Minister said that she is open to renegotiating that contract with Medavie. I want to know if the new minister has taken up that cause.
Minister of Health.
Well, thank you very much. I appreciate the question. And, you know, Mr. Speaker, there's a lot has happened since that report and continues to happen as we move through this difficult time. And again, I do want to appreciate the number of people that, again, stand up and serve the people in the province of New Brunswick, especially the EMTs or the paramedics and the advanced paramedics. And we know that there's those delays are occurring, and for various reasons. That and I'd love to go into the various reasons of how we're trying to alleviate some of that. And I've attended 2 new classes of EMTs, one in Campbellton, one in Moncton, where there will be additional people put onto the ambulances that aren't paramedics, but they will assist them in transfers and also in some of the offload situations. So the point of the matter is that we are taking this serious. We are addressing the issues. We know that it's an overwhelming amount of people going to the emergency room, and we've also made amends and opportunities for them to get that care that they need elsewhere.
Deputy Opposition Official.
Speaker, the Auditor General pointed out that the contract skewed overall response times and contained a raft of exemptions that allowed Ambulance New Brunswick to meet its targets despite having poor performance, especially in rural communities. And Mr. Speaker, the people of New Brunswick are not being well served when a contract results in bonuses being paid out when actual performance is far less than the performance targets actually being reported. All of this while adding pressure to our crumbling healthcare system. And so the failure to revise this contract is continuing to cost New Brunswick taxpayers money that should not be paid out and is allowing New Brunswick an out for improving its performances. I know he will talk about the EMTs. That is one piece of the puzzle that will provide assistance in non-urgent transfers, but it is not going to address what we're seeing in our ERs with long offload delays, long response times to get to a call. Why isn't this minister making it a priority? What is he going to do to directly address those issues?
Minister of Health.
Mr. Speaker, thank you very much. And you know, there are many priorities in the healthcare system. And actually, when you look at the whole continuum, they're all priorities, whether it's preventative care, primary care, addressing the emergency room issues, making sure that the people that are in long-term care in the hospital are back into the community as soon as possible and as safely as possible, whether it's back home with care or in a special care home or into a nursing home. Mr. Speaker, those are all priorities that we work on at the same time. And without a doubt, we've seen some other opportunities, whether it's getting primary care through HealthLink, which has had some great results, whether it's getting some of the prescriptions renewed or looked at, or even some of the dermatology issues can be looked at through eVisit NB. Those are just two examples of how we're providing care for people and allowing them not to go into the emergency room. The X-ray, the portable X-ray machine down in the St. John area, again, preventing people from going to the emergency room.
Monsieur le Président, nous entendons encore des histoires d'horreur où des ambulances sont dirigées vers des hôpitaux situés à plus d'1 heure de l'hôpital le plus proche. Le risque est évident. Le temps de réponse et le temps de traitement peuvent faire la différence entre la mort et la vie. Et les gens n'ont tout simplement pas accès à des soins de qualité dans les délais appropriés. On raconte récemment qu'une ambulance a dû se rendre de Quispam 6 à Moncton pour répondre à un appel. Un autre incident grave a vu un pompier volontaire pratiquer la RCR pendant 30 minutes en attendant les ambulances. Hier, 9 ambulances stationnées à l'extérieur de l'hôpital Georges-Dumont attendaient d'être déchargées. Et les délais d'intervention en milieu rural continuent d'être un problème majeur. Je veux savoir si ce ministre va réouvrir les négociations avec Madavi pour avoir un meilleur contrat, pour assurer un service de qualité pour les Néo-Brunswickois. Il peut tout simplement pas nous dire que les techniciens vont tout régler les problèmes. Est-ce qu'il est prêt à réouvrir les négociations avec Madavi pour un meilleur contrat de service?
Minister of Health.
Well, thank you very much, Mr. Speaker. And again, I point to issues that are solving some of the problems and they diminish them. And again, I appreciate so much the frontline workers, whether they're firefighters, paramedics, RNs, LPNs, NPs, doctors, the list goes on and on, personal support workers. And Mr. Speaker, this whole idea of the continuum of care, making sure that, that people have the care where they need it. And some of the paramedics are actually making calls to the house, doing the treatment right there, and then preventing people from going to the hospital because they've stabilized them, they've assessed them, and they've put them back on the path to again, addressing their issue. But, Mr. Speaker, we talk with Ambulance New Brunswick all the time, trying to make improvements, and I think you're going to see additional improvements in the not-too-distant future to try and alleviate some of the backlogs and some of the issues that are prevalent here in the health system today.
Deputy Bathurst West Beresford.
Mr. Speaker, yesterday the Minister of Finance presented his capital estimates for 23-24. In his speech, he stated, proudly I might add, that he was tabling a $1 billion budget. That was $152 million more than he had planned for the year. But he went on to say that much of this increase is a result of the elevated inflationary environment and supply chain-related delays seen around the globe. Much of this increase, he said. But then I go to scrum with the media, and the first comment I'm hit with by reporters that the minister just clarified that only a portion of that increase is due to these factors, some $50 million. So I wonder, can the minister tell us which talking points he'll use today? Is this increase due to a higher price of what they had already planned on doing, or is this government capable of thinking outside the box and doing anything original?
Minister of Justice.
Well, thank you for the question. I'm called upon to answer today, and it's kind of like being fire chief for a day. You know, you weren't expecting the bells to go off, but in any event, I'll do the best I can. The capital budget put forth today has put the opposition in a complete sense of angst because it's so good.
That's right.
They have been moaning and groaning inexhaustibly about not spending, and then all of a sudden we do a capital budget that goes up 14%, and look, they're screwing themselves into the ground. They're so confused over it. It's such a good story. It is such a positive thing. It is such an investment in New Brunswick. And so the only thing that they can come up with is some kind of a question like, what about a scrum note or something like that? Well, I think we're doing just great.
Time, Minister. The member for Bathurst West Basin.
Oh, Mr. Speaker, this is going to be a lot more fun than I anticipated. Here's an example of progressive thinking. When we were hit with COVID-19, there was a lot of conversation about ventilation upgrades in schools. It seemed very important. It was a hot topic 2 years ago. Yeah, that was yesterday's conversation, but here we have a minister talking about world-class education and looking to upgrade our ventilation next year, only 3 years behind everybody else. Does the minister feel that this is indicative of world-class? Is this what the minister sees as leader of the pack policy and progressive thinking?
Minister of Justice.
There's certainly no shortage of ventilation and hot air across there. So if they would share some of it with the schools, it might be pretty effective. Again, it just shows you they're going back to COVID. This is a progressive budget. It is initiatives that are necessary and proper. It is a tremendous budget. It is a budget that I, the Premier, and everyone on this side of the House are infinitely proud of. It is a budget that is going to bring great results, great investment, make New Brunswick a better place. And again, they're going back to COVID. They go back almost 2.5 years to try to come up with something to criticize the budget over, because there's pretty darn nothing to criticize it. It is a great budget. It's a budget we're happy with, proud of, and it is the largest single investment of capital in the history of the province of New Brunswick.
The Deputy to Bathurst West Basin.
Mr. Speaker, here's what I picked up from the speech yesterday. In his first page of text, the minister brought up that the government was on track to reduce net debt by $2 billion. Last year, he was a little bit more reserved when he waited to almost the end of his speech to state that the government was well on their way to reduce the debt by $500 million. Now, I'm not against debt repayment. I think it's healthy. Where it gets a little perverse is when it becomes the only meritable result you have to your credit, especially when all around you is falling apart, when your constituents are crying for help just to deal with the cost of living. This minister is a one-trick pony. Does he want to tell us what his debt reduction conclusion will be next year? Because with all the opportunities to help that exist out there right now, that seems to be his only fallback position.
Minister of Justice.
No other takers. Again, I have a hard time here because the payment of debt is a responsible thing for a government, a company, or an individual to do. And I have a very difficult time understanding how you can be criticized for paying your bills, how you can be criticized for meeting the obligations that a previous government undertook, borrowed money, issued bonds or debentures. We're paying our bills, which is a good thing, which is anathema to the people across there, because paying their bills never bothered them. They just borrow, 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 spend, 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 borrow, spend, borrow, spend. Well, we now have responsible government in New Brunswick. We now have people that pay their bills, meet their obligation, improve our credit rating, and spend $1 billion in the capital budget.
The Deputy to Kensud.
Mr. Speaker, I'd like to start with a quote that the minister gave yesterday, and I quote, "I have also been clear that if we find that controls that we put in place to assist the tenants are not working, we will reconsider the rent cap." End of quote. So my first question to the minister is, what would these specific conditions be to reconsider a rent cap? What would trigger such a move? I am asking the minister to provide the specific thresholds that would make that happen. The minister has an engineer background, so I'm hoping that empiric evidence is important in her decision. So please, Minister, what with this ever so important file, what are the conditions to reconsider the rent cap? Thank you.
Minister of Service to Brunswick and Housing.
Thank you, Mr. Speaker, and thank you to the member opposite. You got the quote right. That is what I said. And we have our historical data. We have our data that we have collected with the Residential Tenancies Tribunal that shows that we have 112 individuals since the beginning of July that have come to the Residential Tenancies Tribunal asking for their rent increases to be reviewed. We've reviewed those rent increases, made decisions on all those 112 files, and we will see how many individuals, again, start coming to the Residential Tenancies Tribunal. If there appears to be a significant amount of landlords that are taking advantage of the reduction of the rent cap being eliminated, then we will certainly sit down and make some decisions around what other triggers we can pull to protect the most vulnerable in our society. Our government cares about New Brunswickers. We care that they have affordable housing over their heads, and we have the tools in place to help them. Thank you, Mr. Speaker.
Deputy Councillor.
Well, Mr. Speaker, what is clear is a lot of people did receive increase notices, and they're not satisfied, and they don't know about the tribunal. So I know there's a whole lot more people than 112 people. So this government needs to do a better job in promoting that tribunal, for starters. Puis je parlais hier avec un autre économiste très réputé qui me disait que dans les conditions actuelles, un plafonnement des loyers était tout à fait approprié dans les temps qui courent. We also know that there is an equality of power, a natural equality of power between tenants and landlords when it comes to disputes on a rent increase. So what is currently proposed by this minister seems to be out of touch with the real needs. What about help for the people living in poverty? We can do better than putting them in a long lineup for a tribunal. So what can this minister do to level the playing field? Because there is a natural inequality in power. Thank you.
Minister of Service to Brunswick and Housing.
Thank you, Mr. Speaker. There was a lot of different points in that question from the member opposite. So the first thing he was discussing was getting the word out about the Residential Tenancies Tribunal. So I'll speak to that. We have already launched a campaign starting this month to get more information out to the public about the Residential Tenancies Tribunal. But I also need to count on my colleagues here in the House, because oftentimes when vulnerable people are in a situation that they're concerned about, we are the first people that they turn to for help. We have the connections into the Residential Tenancies Tribunal. We can act on their behalf. We can advocate for the tenants. And so that is on us. And I ask that all my colleagues to please, if you have vulnerable citizens that need help with housing issues, contact the Residential Tenancies Tribunal so we know what is happening out in the economy and the housing market. Thank you, Mr. Speaker.
Deputy Councillor.
Mr. Speaker, I'd like to throw an olive branch to the minister because I do feel that there is something that can be done. And this is not regarding the rent cap, even though I do still feel the rent cap would work very well right now. So why is there not a onus on landlords to justify rent increases as to whether an increase is reasonable? Why not put a threshold that is proposed, that if, for example, that if a proposed rent increase is above the consumer price index or another reasonable limit, that there is an onus on the landlord to file a justification rather than having to act on a tenant complaint? So what I am suggesting here is that the onus be put on the owners and not on the tenants. The tenants, like I was saying, there's an inequality there. So when you have the owners have a much more vested interest. So if they would have the power, they would do it and they would get the increase. It would be much better. Will the minister consider that? Thank you.
Minister of Service to Brunswick and Housing.
Thank you, Mr. Speaker. And interestingly, I took a little walk across the hallway this morning to speak to the member opposite because I do want to hear his ideas. As I've said since we've started this discussion a couple of weeks ago, that yes, we are considering everything and any changes for the Residential Tenancies Tribunal. Our goal is to have a balanced situation where tenants and landlords, it is balanced for them. That is certainly an idea that I'm willing to consider. we would have to have a discussion around exactly what that would look like, but that is absolutely on the table. And I also indicated to the member opposite that we are looking at more changes to the Residential Tenancies Act in the spring session. So now is the time to be having this discussion about what that would look like and how we could work cooperatively with the landlords to help protect the tenants more. We have introduced many changes for the tenants to assist them, and we will continue to do that, Mr. Speaker. And I'm happy to sit down with the member opposite and talk about what that might look like.
Merci, Monsieur le Président. Le Fonds en fiducie pour l'environnement a été établi en 1990 et octroie une aide financière à des projets qui visent à protéger, à préserver et améliorer le milieu naturel de la province. Par contre, on apprend dans le rapport du vérificateur général du Nouveau-Brunswick que ce fonds a engagé des dépenses de plus de 77 millions de dollars au cours des 10 dernières années et enregistré un excédent accumulé de presque 41 millions de dollars au 31 mars 2022. Cette année, la période de présentation des demandes s'étalait du 1er au 30 novembre en pleine campagne électorale municipale. Le rapport du vérificateur général note qu'il n'existe aucun plan pour l'excédent du 41 millions de dollars. Est-ce que le ministre de l'Environnement peut nous dévoiler le total des fonds qui seront investis dans la prochaine année et est-ce qu'une partie ou la totalité de l'excédent de 41 millions de dollars fait partie de cette somme?
Bravo. Belle question.
Minister of Environment and Climate Change.
Thank you very much, Mr. Speaker. Great questions across the way. That is it's a great fund, by the way. And as of yesterday, the last numbers I had were 339 projects that came in. And we agree with the Auditor General, there's room for improvement. This didn't happen in the last 6 months. This goes back 20 years. Different governments during that time, I might add. And there's lots going on, Mr. Speaker. The fund is being supported and will protect the environment as it has over the last 30 years, I mentioned. Actually, 3 decades, yes. And great projects. I can list a few here in a minute if you want from your writing, sir. There's lots of money. Nothing's been left on the table. I must go back again that if people don't apply for it, Mr. Speaker, they can't expect to get something. 339 applications are in. We should know early in the spring the successful applicants, and looking forward to working with you to continue making a difference and meeting the guidelines of the Auditor General as laid out in this report.
Thank you, Minister.
Merci, Monsieur le Président, mais c'était ma deuxième ou ma troisième question qui a répondu, pas la première. J'avais demandé au ministre à savoir est-ce que les fonds qui ont été...
Order, please.
Yes, he has a crystal ball.
Order.
Merci, Monsieur le Président. Je vais quand même continuer, même si les gens n'écoutent absolument rien parce que je parle probablement en français. Mais les propositions des projets pour recevoir l'aide financière sous le Fonds en fiducie de l'environnement...
Order, members. Order. Order. Minister. Thank you.
Merci beaucoup, Monsieur le Président. J'espère que mon temps, il me reste 15 secondes. J'espère que je vais avoir le temps de passer à travers. Mais le ministre nous a dévoilé le 339 projets. Moi, j'aimerais vraiment qu'on nous écoute, là. Merci. 339 projets. Est-ce qu'on peut savoir combien valent la valeur totale des projets et combien le ministre s'attend dans son budget? Comment d'argent il s'attend de dévoiler?
Minister of Environment and Climate Change.
Mr. Speaker, applications finished last Wednesday. The total will come in the near future. I don't have that here today, but once I do, you're certainly welcome to have that. Lots of great projects I mentioned, and across the way, back in last year, it was $9.1 million actually, with 263 projects to the ETF, and looking forward to the 339 again this year. Also on top of that, Mr. Speaker, I know the members opposite side of the House, they don't want to hear about success. We have all kinds of success here in the building today. In 21-22, $60,000 for the Eel River Bar First Nation. In 21-22, $32,000 for the village of Eel River Crossing. $25,000 for Velours, $20,000 for the Friends of the Aquarium. Where's that located? $20,000 for the Friends of the Aquarium. $40,000 for the Society, the Management de la Rivière Madawaska. And, Mr. Speaker, all projects I mentioned are in the opposition.
Prime Minister, the member for Cook Cantor Mara. Order. Member for Tantramar. Member Cook Tantramar.
Mr. Speaker, the Minister of Housing has finally admitted that she won't protect tenants by keeping the rent cap in place in the new year. Tenants are terrified of losing their housing if they haven't already. They need protection, Mr. Speaker, but they are getting the cold shoulder from this government. It is clear that there is an affordable housing crisis, and yet this government is doing as little as possible, putting tenants in precarious situations. If a tenant can't pay higher rents or gets rent evicted, then they become unhoused, Mr. Speaker. They lose their home. This province provides little to no protection for renters. What has changed since the rent cap was instituted 9 months ago? Arguably, conditions are the same, if not worse, for tenants. So how can the Minister of Housing justify denying renters the protection of a rent cap next year?
Minister of Service and Brunswick and Housing.
Thank you very much, Mr. Speaker. When I listen to the language that is used and the inflammatory way the question is asked, it doesn't even make me want to answer her question. I can tell you the member opposite and the official opposition asked many questions that it makes it easy to collaborate and want to work together. Mr. Speaker, part of this is our own responsibility, including the member opposite, to take people that are vulnerable and make sure they get the help they need. And the help they need is at the Residential Tenancies Tribunal. We have put a number of different things in place over the last year. We've come back 3 times with changes to try to make things better for tenants, because she's right. People could become unhoused, and we are concerned about that. So we are doing everything we can to protect tenants and make it a balanced approach for landlords as well. So I call on the member opposite to stop the inflammatory way of saying things and work collaboratively to solve this problem.
The member for Member Cook Tantramar.
I do not appreciate the tone policing when I'm talking about people losing their housing, Mr. Speaker. People have lost their housing. People are at risk of losing their housing. And I do help the people who come to me, and I connect them with the Residential Tenancies Tribunal. But they have limitations. There will no longer be a rent cap, and I'm already getting stories. People with 25%, 75%, 100% rent increases coming down the line, and they don't know what to do. And this is unacceptable, but it's very predictable. It's exactly what we thought would happen, Mr. Speaker. Tenants across New Brunswick have been pleading with this minister and with the Higgs government to protect them from predatory rent hikes, especially in these market conditions. And yet, the Higgs government waited till the last minute to admit they wouldn't protect them with a rent cap in 2023. However, the Minister of Housing did leave the door open to bringing one in if it turns out they're wrong again about the housing crisis. Will they bring a retroactive rent cap in March when we're back in the legislature?
Minister of Service and Brunswick and Housing.
Mr. Speaker, last minute, this rent cap was a temporary measure. From the beginning of when we put it in March last year, it was to end at the end of the year. There is nothing last minute about any of this discussion around rent cap. We were clear it was a temporary measure. I've also said we would consider it in the future if necessary. Mr. Speaker, since July, as I stated answering another question, we've had 112 individuals come to the Residential Tenancies Tribunal asking for their rent cases to be reviewed. Only 8 of them were found to be reasonable. 8 of 112, Mr. Speaker. So the work that the Residential Tenancies Tribunal does, it works. They do their job. They look at it works. And the member opposite's again telling stories but not having exact individuals that she's talking about. She needs to go to the Residential Tenancies Tribunal with them.
The member for Member Cook Tantramar.
Mr. Speaker, these are specific stories about people. I'm not going to name their names in the legislature, but I have connected them with the RTT. I'm not sure what the minister is talking about there. But the minister did say there might be a rent cap. They hadn't decided. I don't know. They said it was temporary, but it might be extended. So they're the ones that have created this instability and this confusion. They said that it might be extended. And then even just yesterday in question period, the minister said they might bring one retroactively. So I'm not sure what they're talking about. But here we have We need rents to be stabilized. We need people to be protected in their housing. They have not acted with the urgency required to help tenants, to help renters. What we need, Mr. Speaker, is also long-term solutions. The New Brunswick Housing Corporation needs to have staff. It needs to have subject matter experts. It needs the resources required for non-market housing to be created. Will the Premier revive the NB Housing Corporation and invest the resources needed to address the affordable housing crisis with the urgency it demands?
Minister of Service, New Brunswick and Housing.
Thank you, Mr. Speaker. We are in a housing crisis. This government has recognized we have a housing crisis on our hands. It has not been made in the last 6 months. It has not been developing over the last year. This has been developing over decades. And part of the situation is being caused by the fact that people are moving to New Brunswick, which is fantastic, Mr. Speaker. But we have problems with our success. Our housing stock is at 1.7%. That is not enough, Mr. Speaker. It should be between 3 and 4% vacancy. This government has recognized that there's an issue, and they have appointed their first minister responsible for housing in decades, Mr. Speaker. And with all due respect, I've been in place for 6 weeks, Mr. Speaker. This is a decade-old problem. We are looking at all the solutions and what we can do to move forward and increase our stock. Thank you, Mr. Speaker.
Deputy Restigouche-West.
Merci, Monsieur le Président. On sait que plusieurs bons projets soumis sous le Fonds en fiducie pour l'environnement n'ont pas été retenus ou n'ont reçu qu'une partie du financement qu'ils avaient demandé dans le passé. Le vérificateur général révèle que les critères d'admissibilité ne sont pas clairement définis, qu'il n'existe pas de méthode normalisée d'évaluation du financement des projets et que le ministère n'a aucun plan stratégique ou annuel documenté pour le fonds en fiducie pour l'environnement.
Order, Minister. Order. Order. Yesterday you were quiet. Order.
Back and forth. I will listen to the member for Restigouche-West.
Merci. Vous savez, au moins, vous savez c'est où le Restigouche-Ouest, contrairement au ministre. New Brunswickers should... We know that this government is heading towards another huge surplus. Étant donné qu'il y a plus d'une semaine que le rapport a été déposé et que j'espère que le ministre en a pris connaissance, est-ce que le ministre de l'Environnement ou bien peut-être le ministre de la Gouvernance locale veut nous répondre, vous nous dévoiler son plan pour investir de 41 millions?
Minister of Environment and
Thank you very much, Mr. Speaker.
Climate Change.
Yes, I did read it. Did you? There is a plan in place. We're constant improvements. We always look to, if their education background is that you look at what's working in the past, what you're presently working on, and what you're going to improve on. Lots of improvement coming. We agree with the Auditor General that there's improvement to be done in that area, and we are looking to work with that. It's already taking place right now. The report goes back 10, 20 years, and there's a lot happening right now as well with the Environmental Trust Fund. We don't have the exact amount of total right now in. They're going through the process of seeing who fits the criteria and who doesn't. And I mentioned before some of the projects up your way in the past. We have up your way. There's $30,000 the New Brunswick Community College, $40,000 Société de Rivière-Badawaska I mentioned earlier, and all the ones I read this morning, Mr. Speaker, are from the opposition ridings. Thank you.
Time for question period has expired. Tabling of documents. Yeah. Statement by ministers. Members, we've been asked to revert to introduction of guests. Agreed. Call on the Minister of Post-Secondary Education, Training and Labour.
Thank you very much, Mr. Speaker. Mr. Speaker, it gives me great pleasure today to welcome to the gallery here in the House a number of individuals, some of which have been longtime advocates for people with disabilities here in New Brunswick. There's a number of people that we recognize from the Association of Community Living. They are all here today to listen to third reading of Bills 12, which is an act to amend the Employment Standards Act, and Bill 20, Supported Decision-Making and Representation Act. And I want to point out there's two very special New Brunswickers in the gallery here today, Mr. Speaker. Kira Thomas and Annie Ray. Both of these individuals have been long-term recipients of stipends in this province, and because of Bill 12, Mr. Speaker, those stipends will be outlawed, and work is being done. In fact, one individual in particular, Mr. Speaker, is already earning minimum wage at an inclusion-friendly employer, Mr. Speaker. So I want to welcome them all here to the gallery today, and this is a very exciting day for all of us as we pass these two very important pieces of legislation, Mr. Speaker. Thank you.
Presentation of petitions. Answers to petitions and written questions. Presentation of committee reports. Introduction of bills. Notices of motion. Leader of the official opposition.
Mr. Speaker, I give notice that on December 8th, I shall move the following resolution, seconded by the member from Bathurst West Beresford. Whereas, as of the end of November 2021, there have been 609 deaths in New Brunswick from COVID-19, with additional deaths being reported each week. Whereas, in addition to COVID-19, the respiratory syncytial virus infections in New Brunswick are up 800% over the previous year. And whereas, unlike in some other provinces, RSV infections are not monitored or communicated to the public as a reportable disease under the Public Health Act, attendu qu'il est dans l'intérêt du public de fournir des renseignements à jour et des conseils au public sur les infections virales et les meilleurs moyens de prévenir les infections généralisées, attendu qu'il ne semble pas y avoir de critères établis qui dicteraient quand le suivi et le signalement des virus et d'autres maladies devraient avoir lieu, qu'il soit à ces causes résolu que l'Assemblée législative exhorte le gouvernement à modifier la loi sur la santé publique et ses règlements afin d'inclure le VRS comme maladie à la déclaration obligatoire. Be it further resolved that the Legislative Assembly urge the government to ensure that the Office of Public Health provide regular public updates, advice and recommendations to keep New Brunswickers safe, and release a comprehensive public health strategy to prevent and reduce an escalation of viral infections. And be it further resolved that the Legislative Assembly urge the government to ensure that the Office of Public Health adopts specific policies and protocols to determine when a virus or other serious illnesses should be tracked, reported, and communicated to the public.
The member for Moncton South, his notice of motion for, I believe, December 15th. Yes. The Deputy to Ken Sud.
Je donne avis de motion que le 15 décembre 2022, appuyé par le député de Chédiac-Beaubassin-Capelé, je proposerai ce qui suit. Attendu que, selon Statistique Canada, en 2021, les augmentations de loyers au Nouveau-Brunswick étaient les plus élevées au Canada, attendu que 36 % des Néo-Brunswickois vivent actuellement dans un logement inabordable, attendu qu'en 2021, le taux d'inoccupation des logements a chuté de 3,1 % à 1,7 %. Whereas the government refused to renew the rent cap, which will likely result in many significant rent increases and an increase in the number of New Brunswickers who don't have access to affordable housing, whereas more than 8,100 households are on a waiting list for public housing, whereas the lack of affordable housing is an immediate crisis that must be addressed with a sense of urgency, whereas there are many non-for-profit organizations, municipalities and cooperatives that are interested in entering into partnerships with government to help address the housing crisis, whereas concerned community leaders like Marcel Brun, who are doing their part through innovation solutions like the 12 Neighbours project of tiny housing, whereas other jurisdictions have looked to innovative solutions like design innovations, increased building productivity, modular construction and community land trust, attendu que de nombreuses autres solutions novatrices en matière de logement devraient être envisagées pour encourager et soutenir le développement de logements abordables, y compris des incitatifs fiscaux améliorés et ciblés, l'élimination des obstacles réglementaires et la réduction des formalités administratives liées aux permis et aux approbations. Be it therefore resolved that the Legislative Assembly urge to government to immediately develop an affordable housing strategy that will look at innovative housing solutions, community partnerships, incentives, and other creative ideas to help address the significant challenge of a lack of affordable housing. Merci, Monsieur le Président.
The Deputy de Kent Sud gives notice of motion for Thursday, December 15th. The Deputy de Restigouche-Ouest.
Merci, Monsieur le Président. Je donne avis de motion que le 15 décembre 2022, appuyé par mon collègue de Bathurst-West Beresford, je proposerai ce qui suit. Whereas, in a report of the Auditor General of New Brunswick, Volume 2, Performance Audit 2022, there were significant concerns identified with respect to the oversight and management of the Environmental Trust Fund. Attendu que du fait de ces problèmes, le vérificateur général a formulé plusieurs recommandations à l'intention du ministère de l'Environnement et des gouvernements locaux concernant la clarification des rôles et des responsabilités, la nécessité d'améliorer la planification, l'évaluation des projets et des performances, la prise de décision fondée sur des éléments probants et la production de rapports. Whereas these recommendations were aimed at improving the management, accountability, and transparency of the department in relation to the Environmental Trust Fund, attendu que dans sa réponse aux recommandations du vérificateur général, le ministère de l'Environnement et des gouvernements locaux a indiqué qu'il ne ferait qu'envisager de mettre en œuvre la recommandation relative au résumé et au rapport de tous les projets financés par le Fonds en fiducie pour l'environnement et l'élargissement des rapports pour inclure des renseignements géographiques sur les projets soutenus. Be there it resolved that the Legislative Assembly urge the government to ensure that all the recommendations of the Auditor General related to the Environmental Trust Fund be implemented. Merci.
Le député de Restigouche-Ouest donne avis de motion pour le jeudi décembre 15. Le député de Tracadie-Charles.
Merci, Monsieur le Président. Je donne avis de motion portant que le 15 décembre 2022, appuyé par le député de Victoria-la-Vallée, je proposerai ce qui suit. Attendu que le gouvernement du monde entier sont confrontés à la réalité des changements climatiques et à la nécessité d'envisager un changement transformateur pour faire face à leur impact environnemental, économique et social, attendu que l'élaboration d'une politique énergétique claire est cruciale pour examiner des questions clés comme le développement énergétique, la conservation de l'énergie et la nécessité de réduire les émissions de gaz à effet de serre, attendu que le gouvernement du Nouveau-Brunswick prend des décisions erratiques en matière de développement énergétique sans bénéficier d'un plan énergétique complet qui devrait servir de guide pour la prise de décisions stratégiques axées sur un avenir durable, qu'il soit à ces causes résolu que l'Assemblée législative exhorte le gouvernement à élaborer immédiatement une politique stratégique en matière d'énergie qui porte sur l'énergie verte, les énergies renouvelables, la réduction des gaz à effet de serre, l'atténuation des changements climatiques et l'efficacité énergétique. Be it further resolved that the Legislative Assembly urge the government to put all major energy development decisions related to fossil fuels on hold until the policy is developed and they can be properly evaluated in the context of the policy. Merci, Monsieur le Président.
The member for Tracadie-Charlotte gives notice of motion for Thursday, December 15th. Notice of opposition members' business. The opposition House Leader.
Thank you, Mr. Speaker. Merci, Monsieur le Président. On a l'intention de l'opposition officielle d'appeler la motion 3, c'est une motion sur l'éducation, le rattrapage pour les étudiants, de développer un plan et l'implémentation de ce plan. Et le 12, c'est une motion sur les langues officielles. Merci, Monsieur le Président. Ça, c'est 3 et 12.
The House Leader of the Green Party.
Merci, Monsieur le Président. Je donne avis à la Chambre que demain, nous allons débattre le projet de loi 27, loi modifiant la loi sur les normes d'emploi.
Government motions for the ordering of the business of the House. Government House.
Thank you very much, Mr. Speaker. So we will follow routine proceedings. We will start off with third readings. In order, Bill 3, Bill 10, Bill 11, Bill 12, Bill 13, Bill 15, Bill 19, Bill 20, and Bill 21. Following third readings, we will resolve into a committee of supply for the DTI capital estimates speech only, followed by the opening up of supplementary estimates for a committee of supply. After that is done, then we will move to second reading for Bill 25. Any bill that receives second reading today is referred to the Standing Committee on Economic Policy, and after Bill 25 is done, the House will adjourn to allow Economic Policy Committee to meet to consider the following bills: Bills 16, 18, and 22. Thank you, Mr. Speaker.
Bill number 3.
Is it the pleasure of the House that Bill number 3 be now read a third time? The opposition leader of the opposition.
Thank you, Mr. Speaker, and I thank you for the opportunity to speak again on Bill 3. We had a chance to review this at second reading and at the committee stage, and I wanted to make sure that my feedback is provided here once again at third reading. We have raised a number of concerns with the legislation, and I just don't feel that they were adequately addressed by the minister and his department when we raised them at the second reading stage. And so one of the main areas of concern that was raised was with respect to, well, first and foremost, the privatization of healthcare services. And so we know that, New Brunswickers share concerns when we hear, when we hear of initiatives that might lead to more privatization of our healthcare services, and whether it will be creating a two-tiered type of health delivery. And so where you might have some New Brunswickers that are able to afford to pay for health services, get services in a quicker fashion, whereas those who cannot would have to wait in the queue. And so it's a concern that is rightfully raised whenever we hear about these types of initiatives. The Minister of Health did assure us that it would be a Medicare covered service that is envisioned under the legislation, that the model would be a fee-for-service type of situation, where we see family physicians set up their own types of private family medicine clinics that bill the province for the people that they get through the door. And so with that, though, is that the legislation as it stands is not closed, in the sense that the concern raised if international types of corporate medical surgical corporations would be able to come and set up shop in the province of New Brunswick and do business. The legislation as it stands does not close that door, and we tried with a number of amendments to close that door. We presented amendments to definitions to include who could enter into a contract with the RHA to open up a private facility. We included wording that it would be a person who is practicing in the province of New Brunswick, who is accredited with the College of Doctors and Physicians, and it would be this person who would be able to set up a clinic, and they would be the one entering into a contract. the wording presented didn't suit the minister and his department, but I would suggest that it could have included wording that it would be the person or the professional corporation, as oftentimes it's a professional corporation that sets up these businesses, that hires the people that work in the clinics. And so, again, this wasn't amended to add this wording to close the loopholes that would allow the floodgates to open, really. The minister reassures us that it's not the case, but again, like I said at the time, it's like signing a blank check that we're giving a carte blanche to the Department of Health, to the RHAs, to go and do as they wish with this legislation. And so the legislation is as such that they could go and enter into a contract with an international company that could come and set up shop in the province of New Brunswick to provide surgical services. And so I understand what they're trying to do. It's based around the model of the pilot project in the Bathurst area with respect to cataract surgeries. It was a project that, like the minister likes to point out, we had members there supporting this announcement. It's, you know, dealing with cataract surgeries in the area. It was long wait times, and this is an initiative that can reduce wait times. It's done with a doctor who is accredited by the College of Doctors and Physicians in New Brunswick that can open up that clinic, that can offer the Medicare billing service. And so it's all legit under the Canada Health Act and the RHA's Act and like that in the province of New Brunswick. But again, the door is still open for further developments, and I just couldn't support the legislation at committee without making amendments to close those doors. And so another issue that is raised is with respect to staffing of these clinics. And so I'm not sure when they raise these issues if it's a staffing issue that is giving these long delays for people accessing services, or is it a capacity issue in terms of space? Because we know that they are investing in hospital spaces, surgical spaces in our existing facilities, but at the same time they're promoting privatization for clinics outside of hospitals. And so if it's a space issue, well, why don't we go and look at what kind of space we do have to offer these types of surgeries? But if it's a staffing issue, I don't know if this is going to solve the problem. We know that we're dealing with a staffing crunch all across the healthcare sector. Is this type of facility, this type of clinic, going to go and poach our existing employees because of our government that is not addressing the needs that those professionals are raising, the frontline healthcare workers that are burning out, that are working overtime, making up for lost resources. They're making up for their colleagues that have left because they are burnt out, and they're not given a fair work-life balance. They're not giving fair working conditions, and oftentimes their salary does not meet what they're providing for services. And so will a private clinic now that's coming to set up shop, will they go after those employees and give them what they're asking for and offer them better working conditions, better salaries, better work-life balance, and all those issues that are leading to low morale among our healthcare professionals? And so that's an issue that is a real issue, and I'm not sure what the minister answered in our questions at committee, if they satisfy our concerns. We continuously ask what they are doing to address healthcare resources, human resources in healthcare. We've presented a number of initiatives in our report to stem the bleeding in healthcare. The report that our leader presented, her first order of business when she was elected to lead the Liberal Party of New Brunswick, her first order of business was to go out and talk to healthcare professionals, frontline workers, different associations, professional associations, unions, to get feedback, talk to New Brunswickers that are accessing our healthcare system, to get feedback. And she brought forward, with our caucus, we brought forward a number of initiatives to address these concerns, and certainly around healthcare, human resources, to address recruitment and retention, to be more aggressive in recruitment and retention. And the retention piece centered around showing respect for our workers, the workers that we do have, to address those issues that they are raising, to listen to them and answer the call, because we're going to continue to lose what we have, and a privatization of healthcare is only going to make things worse if we're going to be losing more workers to better working conditions in the private sector. Another piece of recruitment was going to our nursing schools, our universities, going to different programs, those that are studying here in New Brunswick right now, and offering them permanent full-time jobs once they graduate, contracts to come and work in our system. And I don't know why the government and the minister responsible has not taken up that suggestion. It's an easy one. You need the workers. You're short. I don't know how many thousands of nurses, the different reports that we've seen over the last few years. Why not go to our existing programs, the ones that are in first year? Right now, go to all of them, but year after year, go to your first year classes, offer them a permanent full-time position to come work in New Brunswick. Offer them incentives if they need that to compete with other jurisdictions. That is an easy solution that our government has still not taken or to implement. I don't know why they wouldn't do that. Another way that we've talked about addressing access to health care that I've raised a number of times is through multidisciplinary clinics. And this is an approach. We're opening up clinics outside of hospitals, but again, it's under a private model where we're not going to have collaboration between the private entrepreneur, if you will, and the public RHAs of human health resources and that kind of thing. So why wouldn't we go towards a public model of clinics where we can have these clinics publicly owned, where you have a collaboration to share resources and staff, and go one step further and set up these multidisciplinary clinics that would alleviate pressures in other areas of healthcare, not necessarily addressed by this bill, but when we're talking about surgical procedures, but to access primary healthcare, access to non-urgent matters that are clogging our emergency rooms now. Why not have legislation that would go towards a more private, a more public model where you would have better collaboration? You could have more enabling legislation for nurse practitioners. Nurse practitioners have raised a number of issues that I've raised here as well, that they could be a part of the solution, where they could set up these publicly owned clinics. We could set up a team of different professionals around them to offer services that are clogging up right now our ERs and the phone lines, if you will, to get into doctors' offices and into access to primary care. So we should go further and have more enabling legislation for them. There's issues with hospital privileges that they don't have access to, lab tests and that kind of thing. Why don't we look at that as well? So this is one piece of the puzzle, the Bathurst cataract surgery pilot that this is aiming to address. But there are a number of issues that still don't seem to be getting addressed by this government when we're looking at healthcare. We know that New Brunswick is facing a healthcare crisis that I would submit is the #1 issue that we hear when we go into our ridings. Like I said last week in our ridings, that's what I heard day in and day out from different people from different walks of life. The #1 issue for them is the healthcare. When we continue to hear these horror stories of people dying in emergency rooms or that are waiting hours for an ambulance to come pick them up, to go get the health care. When we see yesterday again, 9 ambulances parked outside the George Dumont Hospital at 4:30 in the afternoon. We need more action to address these issues, and I know the minister continuously reads off his list of initiatives that he's putting in place, but I submit it's not working. We're not seeing results to alleviate pressures on our healthcare system. We continue to see long wait times in our emergency rooms, long wait times for ambulances to respond to a call, long wait times in their offloads, people having a hard time accessing primary care. We have to resort to walk-in clinics, or we have to resort to e-visits and that sort of thing. But again, there's no continuity of care in this type of model. We have issues there that need to be addressed in terms of the electronic health records that we've been talking about now for a few years, but it's still not gotten off the ground, where we would have sharing of information between clinics if we had one record for one patient. So there would be more of a continuity of care. And I know we're talking about moving towards multidisciplinary teams. You wouldn't always see the same person, but you would at least have better continuity of care in that regard. And so those are some of the initiatives we're asking this government to address that are still lacking, and that we're asking for more action to take it more seriously. On parle beaucoup de la rétention et le recrutement. J'en ai parlé tout à l'heure. Notre plan de santé que notre chef a mis en place dès qu'elle s'est présentée, dès qu'elle a pris position comme chef du Parti libéral. On a présenté toute une gamme de solutions pour adresser la crise. On demande que ce gouvernement en mette en place. On parle des centres multidisciplinaires qui pourraient soulager la pression sur les salles d'urgence, soulager les temps d'attente pour des soins primaires. Et ici, on a un projet de loi. On va plutôt vers la privatisation. On a soulevé des questions en ce qui concerne qu'est-ce que ça va faire pour affecter le recrutement ou la rétention de nos employés en santé. On a parlé les conditions de travail du personnel en santé présentement, les infirmières, les infirmiers, toutes les différentes personnes qui fournissent des services. Ils parlent des conditions de travail, les charges de travail. Ils cherchent un meilleur équilibre vie-travail. Mais ce gouvernement ne répond pas aux questions qui sont soulevées. Et puis, on demande que ce gouvernement adresse les questions. Et puis, c'est pourquoi on parle de ça. Et puis, la privatisation va aggraver la situation. Est-ce que des cliniques privées vont aller chercher le personnel du système public et puis nous laisser dans une situation plus grave qu'on était au début? Donc, ça, c'est une question qui n'a pas été répondue lors des sessions en comité. L'autre, c'est par rapport à la privatisation des cliniques. Est-ce que des corporations à l'international vont avoir la capacité de venir et se mettre en place ici? Le ministre nous a dit continuellement non. On sait que le projet pilote à Bathurst, en fait, c'est un contrat avec un médecin de la région, et puis c'est ça qu'on demande. C'est pour ça que j'ai apporté des amendements. On a mis des amendements sur le plancher pour fermer les failles dans la loi. Et puis, une de les failles, c'est que des corporations peuvent venir s'installer ici et entrer dans un contrat avec un régie de santé. Il n'y a rien qui ferme la porte. On a demandé de mettre des définitions dans le projet de loi pour fermer cette porte. Et puis, la modification qu'on voulait apporter, c'était en fait même les mêmes paroles que le ministre de la Santé nous a données tout au long de nos questions, que ça sera un contrat avec un médecin qui est accrédité dans la province du Nouveau-Brunswick pour pratiquer dans son domaine. Et puis, il n'a pas voulu mettre ça dans la définition. Il a dit, en fait même, si on met ça dans la définition, ça va aller à l'encontre de l'intention de la loi. Donc, je trouve ça un peu ça donne la confusion un peu, ces réponses à cet égard. Donc, je demande pourquoi on n'a pas voulu modifier la loi avec ces définitions. Une autre définition une autre modification à la loi qui a été apportée, c'est par rapport à l'accès à l'avortement au Nouveau-Brunswick. On sait depuis longtemps qu'il y a une clinique ici à Fredericton, la clinique 554, qui demande de faire des avortements dans les cliniques privées. On demande que ce soit financé par Medicare, mais ce gouvernement, depuis longtemps, a refusé de modifier le règlement 84-20 pour donner un financement aux cliniques privées, pour donner ces chirurgies. Donc, c'est ironique que le gouvernement veut aller vers la privatisation, mais là, on parle des avortements, on dit non, on ne va pas aller là. Donc, il parle aussi, le ministre avait parlé, il n'y avait pas de liste d'attente pour les avortements. Donc, je trouve ça troublant aussi, quand il a répondu à ces questions, qu'il n'y avait pas de liste d'attente, parce qu'en fait, ce n'est pas quelque chose que des femmes vont attendre des mois puis des mois, des années sur une liste d'attente pour un avortement. Ça n'a pas de sens. C'est quelque chose qu'il faut avoir accès immédiatement. Si l'accès n'est pas là immédiatement, un accès sécuritaire, ils vont aller chercher l'accès ailleurs. Mais si il faut voyager des heures et des heures, souvent ça peut être des jeunes femmes qui s'éloignent de leur famille ou des personnes avec qui prennent soin d'eux, et puis ils sont dans une situation vulnérable. Ça les met plus en sécurité. Donc, il faut avoir un accès proche et puis un accès financé par le public. Donc, je me demande pourquoi la seule province dans le Canada qui n'offre pas ces procédures en clinique privée. Donc, ce gouvernement a refusé, voté contre cet amendement à la loi. So, Madam Speaker, those are my comments. I guess I wanted to put it on the record why I oppose this legislation. We support the pilot project in Bathurst. It's a contract with a doctor accredited to do practice in the province of New Brunswick. That's why we inserted amendments to insert that type of arrangement in the definition of the legislation, but this government refused to adopt those amendments that would go and meet what the intentions are of this minister. What he answers time after time about the concerns about privatization, we wanted to put his wording into the definition, and he refused to do so, which is troubling. We wanted to close the door to prevent the further privatization without the checks and balances of having to come back to the Legislative Assembly. It's essentially giving a carte blanche to the RHAs to now go and enter into any type of contract they want to provide private surgical facilities. So those are the concerns I have, the concerns around staffing of those clinics as well. They did not provide clear responses on how the staffing is going to be addressed, and the concerns that we have that it's going to continue to put more pressure on our current healthcare system where we are struggling, where we have thousands of vacancies that we need. And so those are my concerns. I'll leave it at that. So thank you very much, Madam Speaker.
Recognize the member for Fredericton South and leader of his party.
Thank you, Madam Speaker. On the bill, Madam Speaker, on Bill 3, the bill respecting surgical facilities, I agree with its objectives. I agree with the minister's intent here, what he's trying to do, but this bill is just not ready for prime time. We heard from an expert publicly, Professor Claire Johnson at the University of Moncton, an expert in health management, and she pointed out in the media interviews she did that there is good evidence that surgical centers located outside of hospitals can free up time for hospital surgeries if they are publicly owned. Because she also pointed out that there's good evidence that when those surgical centers outside of hospitals are corporate-owned, that ends up costing the patients money because of the extra costs and medications that are sold there, because of the upselling that goes on. That her proviso was, and I agree with it, that these are good ideas. They can make a real contribution to improving our healthcare system when they are publicly owned. And it's because of this, Madam Speaker, that I tried to amend the bill at committee to simply close the door to corporately owned surgical centres, which would be profit-driven and beholden to investors looking for dividends. And our surgeries should never be driven by the profit motive, Madam Speaker. It was a very straightforward, short, clear amendment, Madam Speaker, but government members voted it down en masse. So, Madam Speaker, this is one of those bills where it really is time for second sober thought. All the minister and his colleagues have to do is bring the bill back with a minor change to shut the door on corporate ownership for surgical centres outside of hospitals. That's it. That's all. It took a while to get the minister to acknowledge that, in fact, the bill opened the door to corporate ownership. But finally, at committee, he acknowledged that, because it's true. There is no protection in the bill, nothing in the bill, no prohibition on the bill to prevent corporate ownership. So as I said, it's time for second thought, sober second thought. And that's why I want to bring forward an amendment to give this minister and his colleagues some time to think about how they could tweak the bill, achieve the objectives it's set out for, which are positive and good, but tweak the bill to slam the door on corporate ownership tight. So, Madam Speaker, I want to move the following amendment, seconded by the member for Kent North, that the motion for third reading be amended by deleting all the words after the word "that" and substituting the following for Bill 3, an act respecting surgical facilities, be not now read a third time, but that the bill be read a third time this day, 6 months hence.
It has been moved by the member for Fredericton South, seconded by the member for Kent North, that the motion for third reading be amended by deleting all the words after the word "that" and substituting the following. Bill number 3, an act respecting surgical facilities, be now read a third time, be not now read a third time, but that the bill be read a third time this day, 6 months hence. Do we have speakers on the amendment? Having no speakers on the amendment, all those in favor of the amendment will please say yay. Yay. All those opposed will please say nay. Nay. I believe the nays have it. The amendment is defeated. If there are any further speakers on third reading? I recognize the Minister of Health.
Well, thank you very much, Madam Chair. I appreciate the opportunity to speak on Bill 3. It's not normal that people speak on Bill 3 after second reading and committee of the whole, but it is a great opportunity to correct the record set or at least said by the opposition members. It's interesting because the role of the opposition is to keep government accountable. But what's happening here today is that government has to keep the opposition accountable, because they seem to have one song in the north and another song in the south. One song in the back room, but another song on the front row. Right. Mr. Speaker, the inconsistencies that I have seen being put forward by the opposition here today is just astonishing. So I'm going to set the record straight on this. I'm going to set it straight, and you know, it's interesting too that a number of the members were concerned that there was a motion to limit debate on various bills, and they complained when there was an audience in the chambers. But here today now they've taken a period of time to again, for what reason? Again, I'm still a little baffled to fully understand why the member would get up. And I'll tell you, I was in Campbellton the other day. and visited the school. that's going to be training the EMTs to again, alleviate some of the problems here with the congestion and making sure that there's adequate ambulances on the road. And that was dismissed by the government. Government didn't think that was good enough. I was in Moncton. I visited the first days of EMT school on St. George Street in Moncton. There were 20 students there. I congratulate them on starting a career in this area. And that's just a start, because once you get the EMT, you can advance and go into as a paramedic, go into as an advanced paramedic, so you can earn and learn at the same time. The members opposite said that wasn't good enough. They didn't support that. You know, so they stand here and they say, help with the healthcare system. You've got to help with the healthcare system. But anytime we put anything forward, initiatives or whatnot, they say, well, that's not good enough. It's the yeah-buts. So, you know, Madam Chair, this is where we have to hold the opposition accountable, because they shouldn't be able to say one thing one time and then say another thing the next time when it's just convenient to fit in. And, Mr. Speaker, I know they seem to have a bias against big corporations, and I know the Leader of the Opposition was on Moncton City Council when they booted Medavie out as their medical provider, a downtown business that had 5,000 employees in downtown heart city of the Moncton. Yeah, and kicked them out. We went with a company. Went with a company with one person here in New Brunswick. So it's interesting here that there seems to be a bias against big companies. And when you talk about companies, the RHAs are the ones that have the relationship between the corporations. And this particular Bill 3 was an arrangement between Vitality and the Bathurst Eye Clinic. So again, the members opposite have put out an impression that this is just kicking the doors wide open with no control, and that anybody and everybody can come in here and set up an operating clinic. And again, that's just not the case, because people have to have an agreement with the RHAs, and the people that are operating have to be licensed here in the province of New Brunswick. And to be licensed, you have to have a billing number, and to get a billing number, you have to have privileges at the hospital. So there are so many checks and balances along the way. And again, when you look at a company like Johnson & Johnson, it's a big company, it's a big corporation, and they provide a service to the RHAs. So why are the members across the way not attacking Johnson & Johnson? Or I guess they really are. And they provide a lot of services to our RHAs. What about McKesson? McKesson is one of the big drug companies. It's a corporate-owned entity, and I don't know if it pays dividends or not. I would think it is, because it's a big company. Members are attacking that company and the number of employees, again, here in New Brunswick, providing the service to the people in the province of New Brunswick. Mr. Speaker, there's about 130, roughly 130 different drug companies that are operating here in the province of New Brunswick, and most of those, as I understand, are shareholder-owned companies and nationally owned. And those are the types of companies that the members across the way are speaking against, providing drugs to help the people in the province of New Brunswick get better, and again, depending on whatever ailment it is, if the prescription is put forward. Not being a clinical expert, I wouldn't know what drug to provide, nor I would suggest the members across the way would. But those agreements are all negotiated. Those prices are all negotiated with again, people that are tasked with making sure you get the best return from a cost-benefit ratio on having these drugs available for the people here in the province of New Brunswick. And, Mr. Speaker, when we find solutions and the opposition stands against it, but then they can say, oh, well, it's good, but we don't like it. I mean, the results are there. The results are there when you can look at eVisit NB. eVisit NB has up to 569. There was one day they had 569 people go on that platform and receive services. And those services are preventing people from going to the emergency rooms. You know, when you look at someone who shows up with strep throat in the emergency room and has to wait for a while, well, the fact of the matter is, the fact of the matter is that You know, again, with an e-visit, you could get a prescription, and that can be done. The turnaround time is probably within 15 minutes, which is very, very good. So I just received a note from my House Leader to keep it short, and I want to comply with my House Leader to make sure that I don't go offside. But again, the fact of the matter is we're having success. We're having success on things like HealthLink, NB Connect, and I visited in Lamec. I went to Lamec, and there was, again, a HealthLink operating there, and I met with the RN and the manager, and they're already having doctors line up to help them with the people that are being connected. Same thing down in the West Main Street of Moncton, where the clinic is there, and people are being connected. And I'm getting the reports back. I had one here today from one of my colleagues, again, saying, excellent service. I had an appointment within a day or so, and really very, very good service, getting that primary care. We know there's more work to do. We know there's more work to do, and that's why we continue to work very hard in order to do that. When I was in Lamec as well, I went and visited the hospital. There's a renovation going, or the health clinic. There's a renovation going on there that is going to have a family medicine practice where the doctors do share the patient records, and there's some NPs involved as well. So if the triage is done and someone needs to talk to an NP as well, they're on staff. So you may not see the same doctor every time, but you will see somebody in a very, very short period of time. So that's the collaboration that's going on already. And people may not be aware of it because maybe they didn't go to Lamec or haven't visited or don't have that information. But the fact of the matter, a number of the issues that are being brought forward here on the floor are actually happening. They're actually occurring. And the members opposite don't want to talk about the gains that have been there. They just want to talk about the gaps. And we know that there's more things to be done. And it's interesting, Madam Chair, that the member opposite put on the floor today a motion that directs public health on a number of things to do. Now, Madam Chair, that is political interference. We know that the Chief Medical Officer is an independent body, and that independent body is what has advised this government many, many times during the pandemic. But the member opposite now is putting a motion on the floor that is trying to direct and put political interference into public health and the Chief Medical Officer, which is unfortunate. But again, to comply with my leader, my House Leader, I'll wrap up, because apparently people must be hungry, want to go to lunch or something. Well, Mr. Speaker, healthcare is important work as well. And we're making sure that people know that we're doing the work that needs to get done to make sure that the people are getting the health care that they need. And again, when we talk about some of the gains that have been made, I think it's very, very important that is realized and recognized. Every time I get near a mic, I want to say thank you to the frontline workers. And I can't say that enough, how much we appreciate them, how much we appreciate the work they're doing. So I'm going to wrap up my comments at that point in time, Madam Chair, but I appreciate the opportunity on speaking on Bill number 3 to, again, set the record straight from the opposition.
I recognize the member for Campbellton Dalhousie.
Thank you, Madam Speaker, and I'm pleased to rise and speak a little bit after the Minister has spoken. It's an honour to be able to speak after the Minister and make some comments. I'm glad to hear that he's adopted the philosophy of the Minister of Municipal Affairs and Local Government to travel the province. Maybe he knows there's a new opening at the head office somewhere that he's campaigning for. I don't know. I know the other minister was gung-ho to get around the province and meet people and extend his wings so that he would be ready for his leadership campaign. And since then, he's been a little less vocal. Now we have another one standing up and traveling the province, I guess. He's been everywhere, man, basically coming up. It's interesting. He's going to get a new reputation. He doesn't. But anyway, I take the minister's comments at face value. I guess he believes in what he's doing, and I know that they don't like to be criticized or to have different opinions, because what they do, Madam Speaker, is is they put time allocation. They said, oh, the minister was complaining that we were debating this at third reading. It doesn't happen often. Well, it doesn't happen very often that a government is trying to privatize health care. You know, it doesn't happen often. It doesn't happen every day. And that's why, hey, wouldn't you? If you thought, now this is debatable, if you thought that the government was trying to privatize health care, wouldn't you think you would stand up and talk about it? Yeah, so they can stand up and defend it. They can. I didn't hear the minister once say that they are not privatizing health care. Not once. Didn't say that. He railed against the opposition that we weren't this and we weren't that, and we're criticizing, and they're keeping us accountable, and he had all these innuendos out there, and we could have raised points of order that he wasn't on the bill, but I said, well, if he's not on the bill, maybe I don't have to be on the bill either. So that would be a nice precedent. Anyway, what impressed me, besides the travel, is where he traveled to. Now, Campbellton is my riding, and he mentioned he was up there to visit the community college and talk about the courses there that are helping healthcare, and they're excellent. They've been doing that for a number of years. It's our community college in Campbellton is something to be very proud of, and I am very proud. Je suis très fier de leur collège communautaire à Campbellton, puis les cours qui sont donnés là, les professionnels qui travaillent, les enseignants, enseignantes là à Campbellton, au collège communautaire, puis je suis toujours très impressionné. Puis le travail qu'il fait pour nos étudiants postsecondaires, c'est remarquable. Puis je leur félicite. And, the minister said we were against those courses. We were against that. They don't listen very well over there. We applauded it when he mentioned that. We applauded it. So you applaud, we're doing it wrong. You don't applaud, oh, you're too critical. So I don't know what the minister is trying to do, but what I would have said to the minister if I would have been invited to his visit, and I know the minister well, and I'm respectful of him, and I always have been, and continue to be. But instead of, while he was there, the health minister could have walked up the hill, was within walking range. Or if you wanted to drive, I'd drive him up if you wanted to, or I'd walk with him. And he should have walked up to the hospital. There's a regional hospital there, just up the road. Maybe he didn't realize it. But he could have visited the regional hospital. He could have, on his way in, he could have looked at it and say, oh, what's that? And if I would have walked with him, I would have said, oh, those are the 3 or 4 ambulances that are waiting to offload patients. Because the emergency room is overutilized. But, you know what he said? He said, results are here. Those are the results that he's talking about. There's something wrong there. Then he could have gone in and visit the ER room and looked at the people who have been waiting. He could have talked to a few patients and say, how long have you been here? 8 hours. Oh, yeah, okay. 12 hours. Oh, talk to the mother with the child there. You've been here 10 hours? And it's not the fault of the medical staff. We have top-rate medical staff at the Campbellton Regional Hospital, and I'm proud of that. So it's not their fault. So he could have also toured the building and talked to some of the nurses that are there, talked about their double shifts that they're doing. He could have asked them, you know what would have been nice? Sit down with them and say, listen, if they had time to sit down, because they're working all the time, it would have been nice for him. Do you have any ideas or solutions that maybe we could do something differently? Could have asked that. Consultation. Yeah, consultation. And that's something that they don't usually do, this government. And I'm surprised at that. I'm very surprised at that. that they lack that concept. It's so easy. They would do your work for you if you talk to the health professionals, if you talk to the doctors, the nurses, the nurse practitioners, and ask them for some ideas. It would be great. It would be great, and they would be able to help you out. So there's all of that. Then, after the hospital visit, I could have showed them up on, I think it's the second or third floor. There's a walkway into the Rescouche Hospital Centre to see, and that's part of the health department. He could have walked over there and see the ultra-modern facilities that exist there and the need for more resources. Not money-wise. We need staff. We need staff. That's the thing. We need a recruitment and a retention plan. And yes, they say they're recruiting all over the world. Something is not working. Maybe we should be getting more doctors involved with the recruitment or more nurse practitioners. You know, they've been in government 4 years. 4 years. Is the health care system better now for it? Is the health care system better after 4 years? Ask yourself that. Are you better off? Are you better off when it comes to health care in the province of Brunswick after 4 years of this government? Worse. I would suggest that, from what we hear from our constituents, that we're probably worse. Yeah. So I just thought the minister also made comments about the results are there. Well, I don't have a healthcare professional. My wife does. I don't. I had a doctor at one time, and she didn't. She went to a nurse practitioner, and I'll tell you, the nurse practitioners are super, 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 super. They do a great job, and they've been an asset, and the expansion of that program is going well, and it was a good move by the government to expand the, and it was the minister that I know quite well. He's now the Justice Minister who moved very quickly with that, and I have to give him credit for that. And the minister, who is now Minister of Social Development, did some strong follow-up on that as well, and deserves a lot of credit for her efforts and her work towards that. So that was a good move on their part. Okay, that's a good move on their part. So I have no choice, but as an e-visit, I use that e-visit. It works. It works up to a certain limit. Okay? Like prescriptions and things like that, but you're not seeing face-to-face. And doctors will tell you, nurse practitioners will tell you, they gain a lot by meeting the person face-to-face. They can, yeah, how you look, things like that, and they'll tell you that, time in and time out. Okay? So I think there's that's missing. I know that I think a year and a half ago, I asked at that time for a dermatology visit with a dermatologist. I couldn't do anything on the phone or on the e-visit category because I might have charged for. I might have had a criminal charge in public, so on the airways. So, but I asked for that, and I'm still waiting for that. So I don't know where it is. I don't know if it's a follow-up. And then I sort of wonder in my head if I do get a consult with a dermatologist, or I get a consult with a specialist, or if I get X-rays, which I think you're allowed to do, the e-visit, or I think you're allowed to X-rays. I just wondered who gets the results? Where do they go? I don't have a health professional, and I know they probably have an answer, but that's one thing I often wondered about, and I meant to ask someone. So same thing as the request to see a dermatologist. I sort of wonder where that went, because I never got a confirmation that their recommendation had gone there. I never got a confirmation, you know, like, I don't know where there's no file on me in the health records as far as I know, because when my doctor decided to end their career, they said, here's your file. You know, so I have my file at home. So, I think the minister wants to revert to something, I don't know, I have a note here that, well, okay. Well, if I can return to the floor after, I think if there's an agreement, I guess there's an intervention from the government that they want to do before noon hour, and if I can be seated but have permission to return, not cutting me off like you usually do. Okay, I will.
Stand up if you want me to. I recognize the Government House Leader.
Thank you, Madam Speaker. So I just want to move to adjourn the debate on this. We have members in the gallery who are here for two specific bills. So after I do this, I'd like to make a motion to revert to government motions for the ordering of the business of the House, put those bills up so that those folks can see the result of third reading for those bills, and then we'll put this at the bottom and we'll continue on with the same thing. So I just need consent of the House to do that. Or we can, or if the member wishes, after we do this, go right back to it, we can do that too, whatever the member wishes. Yep.
Much left on the debate. I think there's not that many more speakers, and just 100%. To continue it on, we'll have the linkage there, but we would go along with the government wish to revert to government, revert to a bill now, revert to the other two bills, and what the idea that I would retain my speaking position.
Yep.
There is a motion to adjourn the debate on Bill 3. All those in favor?
Yay.
All those opposed? The adjourned bill. The discussion on Bill 3 is adjourned. Government House Leader.
So we're turning to government motions for the ordering of the business of the House. We would like to go to Bill 12 and then Bill 20.
Consent for the government motions to.
You could do it. Sorry. Third reading. I'll say Bill 12.
All right, third reading.
Bill 12.
Is it the pleasure of the House that Bill 12 be now read a third time? Oh, I recognize the member for Tracadie-Shiloh.
Thank you very much, Madame la Présidente. I did want to speak on third reading. I've got a couple of minutes. I surely don't want to have our guests have to come back after lunch. I'm a little bit disappointed with government because they should have started with this bill. It's not the first time that they've actually made this mistake. But it was important for me to actually get up. Sorry, I'm just going to clear my voice. Give me 2 seconds. It was important for me to get up on this third reading because we wanted to show our support for this bill on this side of the House. It's actually a very good bill, and I want to thank you for bringing it forward. I know they've worked for years. They've been pushing different issues for people with disabilities, and I'm glad to see that we were able to cross this, bring this to the finish line. It was unanimous here on the floor, and I wanted to say thank you very much. And the only issue that I did bring up during committee was just to be able to help the day centers, the agencies, transition over. Obviously, they're relying a lot on core funding. And, maybe it's time for government to kind of, look at the formula to see if we can help them out even more. So that's all I wanted to say. I wish I could have spoken a little bit more, but again, I want to say thank you very much, and time to vote on third reading. Thank you.
Order, members. Order. Is it the pleasure of the House that Bill number 12 be now read a third time? All those in favor of the motion will please say yay. Yay. All those opposed will please say nay. In my opinion, the yeas have it. I declare the motion carried.
And I commend the Employment Standards Act.
I recognize the member for Post-Secondary Education, Training and Labour.
Bill 20.
Bill 20. Is it the pleasure of the House that Bill number 20 be now read a third time? I recognize the Minister for Post-Education. Are you speaking on? No? Okay. Les députés qui appuient la motion voudront bien dire oui. Oui. Les députés qui s'opposent voudront bien dire non. À mon avis, les oui l'emportent. Je déclare la motion adoptée.
Supported decision making and representation.
It now being 12 o'clock, pursuant to the orders of the business of the day, the House will be adjourned.
much.
Yes. Thank you.
Well done.
Speaker.
aside, Mr. Speaker.
What are we? Resuming the adjourned debate on Bill number 3. Call for the member for Campbellton Dalhousie.
Confidence motion. In me? Good afternoon, Mr. Speaker. And as you know, my speech this morning, I was on a flow, and you were probably listening to me intently. And now that with the interruption, which we agreed to because the government wanted, and that shows how we tend to cooperate around here, and we get things done better when you cooperate and you talk, and rather than try to do things outside of that element. But we had agreed that we would push a couple of bills ahead because I had the floor at the time, and we agreed. So that's why the bill is back, Bill 3, and I have a chance to talk. And just to refresh your memory, Mr. Speaker, in the speaker previous to me was the Minister of Health, and he was talking about his visit to Campbellton. And I visited the community college, and I mentioned how that was a good visit, it was a good class, but a good course that he visited, and this and that. But I encouraged him that he should have gone up the hill a little farther. There's a regional hospital there. And if he would have been there, he could have, on the way in, if he would have asked me to go with him, I would have gladly gone with him. Would have driven him around, in fact, to show him all of what's in our area, because we have a lot to offer our area. And I would have also, on the way in, he would have probably been looking around, and as a minister would, I would expect him to, and he probably would have asked me over there, well, I would have pointed out, those are the 3 or 4 ambulances waiting there for a couple of hours probably, waiting to offload their patients. And I said, that's one of the issues. So I'm not going to repeat all what I said, but one of the things that could have been said is as he went into the hospital and visited the ER room and spoke to some of the patients and some of the staff, he could have gone further into the hospital for a visit and speak to other staff members there, and he would have heard that they're working hard and diligently, and I know the minister knows that, and I appreciate the minister's intervention today, where he mentioned the healthcare workers and giving them their thanks for their commitment, dedication, whatever. And we don't question the quality of care given out by our health individuals, our health professionals. The problem is, though, we don't have enough of them, and that's where we don't see a lot of action. You know, and I mentioned, ça fait 4 ans que ce gouvernement est en pouvoir, Monsieur le Président. Puis ici, on regarde les résultats. Le ministre a parlé des résultats, mais si on regarde les résultats, on commence de 4 ans passés à aujourd'hui. Est-ce qu'on a amélioré le système de santé? Ça, c'est la question. C'est un problème majeur. Le ministre ne sait pas comment le faire. Il aurait dû prendre l'occasion de visiter l'hôpital régional, parler à des professionnels, m'en dit, il pourrait leur dire, « Hey, je ne sais pas quoi faire, peux-tu m'aider, peux-tu me donner des solutions? » C'est ça qu'il aurait dû faire. C'est ça qu'il pourrait faire, rencontrer les professionnels, les demander pour des recommandations quoi faire, au lieu de manque de consultation, au lieu de manque de solutions, au lieu d'un plan vide. Un plan vide, il aurait dû parler à des professionnels, au lieu d'aller quelque part d'autre à ce moment. So, as I mentioned to the minister, he should have come for a visit to the hospital. The health minister should have come to the regional hospital, and he would have seen what I said this morning. And in that hospital, after he visited the hospital, he would have heard from health professionals, and he would have heard from the patients that are in the emergency room, and maybe even from from others in the community. If he would have had lunch in the community, I don't know if he did or not. He didn't invite me anyway, if he did, or he didn't invite my colleague. I would have paid for the lunch just to have an audience with the minister to talk to him about the lack of obstetrics at that hospital. That is unacceptable. C'est inacceptable qu'il n'y a pas d'accouchement à notre hôpital. C'est un hôpital régional, c'est l'hôpital régional dans la province qui n'a pas d'accouchement. Puis c'est inacceptable. C'est inacceptable. So we'll continue on that visit. While he was at if he would have visited the hospital, Mr. Speaker, he could have come up on, I think, the second or third floor. There's a little catwalk, and he could have gone across and visited the new ultra-modern Rescouche Hospital Center. Il aurait dû prendre le temps et la patience de visiter le centre hospitalier de Rescouche, ultra-moderne. Ultra-moderne. And he would have found there, Mr. Speaker, a similar situation that exists is a lack of personnel. Not enough recruitment being done, not enough retention being done. And that's where the minister has to focus his energies, not on parading around and talking how great they are. We know how great they are. From 4 years ago to now, ask New Brunswickers what they think of health care. Has it improved or has it gotten worse? So at the visit, what's going to happen at those hospitals, and we see it in other areas, there's some serious issues with health care, and it's creating an issue for patients. We're losing some patients due to a lack of health care availability, access to quality health care. And that's on the minister. And you're going to see the same thing happen in a hospital centre. You're going to see the same thing happen there with the lack of resources. You're going to see something serious happen. And that's what happens. That the minister is neglecting, as far as I'm concerned, his recruitment urgency. And you have to, anyone in conflict, in urgent situation says you want to resolve something, treat it as an urgent matter. This government, 4 years, did nothing for recruitment, did nothing for retention. And that's a fact. That's a fact. They're scrounging now, scattering all over the place, and they think there's an election coming in a year or two, and so now it's the time to do a little more. Now they're being a little more urgent. So, also, while they were at the hospital centre, they could have very easily, with my guys, could have walked out with the
Member, please.
To the proposed Centre of Excellence.
Member for Hamilton Dalhousie, please sit down. I have a point of order. No, sit down, please. You have a point of order?
Yes, I do. I have a point of order, Mr. Speaker. The member opposite, besides being disrespectful to you, is not addressing you, and he's addressing and it's been clearly stated that the person should speak to the chair. Secondly, he is way off the bill, and I think he should be brought back. And he's very inaccurate in his statements that he made about recruiting.
Member, you.
I have a separate point of order, Mr. Speaker.
Okay, let's deal with one at a time. Member, I would caution you just stay on the bill if you would, please. I have a point of order over here to.
Yeah, Mr. Speaker, while the member was speaking, I clearly heard the Minister of Health say these words: "You're a liar," Mr. Speaker. Now, Mr. Speaker, we know those words are unparliamentary, and I would ask that the minister withdraw those.
Not up in the record, is it? Member, I can't say that I heard that remark, and so I just caution everybody to remember that we are all honourable members, and I would ask that you be very careful in the words that you choose to use. Do you have a point of order?
Monsieur le Président, je voulais juste seconder mon collègue puis dire qu'on a entendu l'exacte même chose ici, nous autres aussi. Merci.
Thank you. Okay. Okay. Let's have some decorum in the House. And Minister, if you would, speak through the chair. I caution all members, or tell all members to do that. Please proceed, member.
Thank you, Mr. Speaker. I appreciate your intervention. I just want to mention that I worded my comments based on the minister's speech this morning, where he talked about a trip to Campbellton and visiting the community college. So that's what I was talking about when he intervened. I guess he's a little like the minister of municipal affairs and local government, likes to travel a little bit, but at least the minister did visit a lot of communities because that was his mandate. And I just was mentioning to the minister would give him a chance to, as a health minister, to visit the hospital. It was right next door to the community college, just up the road, and I would have taken him. And I talked about the hospital. I'm not going to talk about the hospital again, but then we're on the second floor of the hospital, going on the catwalk to the next center, the hospital center. And that's, again, where he got upset, because he knows that there's not enough resources there. He knows he's not doing his job, and he's embarrassed by it, by making foolish points of order, as far as I'm concerned. So, Mr. Speaker,
to the bill, please.
Yeah. Okay, so now, the next thing that I would like to, well, I guess I'll go right into the bill then, but on his way away from Campbellton, he talked about that. His way, he went down to visit the Lamech area. Okay, but on the way, he could have stopped at the Dalhousie Community Health Clinic. He could have stopped at the clinic in Jack River to see what their needs were, and he ignored that. On the Bill 3, if I can get a little more specific, if that's what the indications are, the minister would appreciate that. One of the things that I haven't heard much about on this bill is the use of this facility fee in the bill. And we haven't heard much about that, but if the cataracts were being operated on in the hospital, there's no facility fee. So there's an extra cost here, and it's going to the health budget, I would suspect, because it's not recouped anywhere else. Because I'm sure the doctor in this case is not going to absorb those costs. So there's a facility fee. The other thing with regards to cataract surgery, and that's something that the minister would have heard if he would have been doing his duties and visiting the hospital when he had a chance, but maybe he had a set schedule, and I can see that. So I would, Mr. Speaker, through you, invite him back to Campbellton, and I would be more than pleased, or my colleague from Restigouche West, to take him around. We'll take him around together. And we'll certainly show him the fine points of the area, but also the health issues. But on the cataract surgery, the reason why, one of the things I wanted to speak of this is the lack of creativity, not only by this government, but by the vitality that I've seen. They're very quick to come up with solutions that are the easy solutions. They're not necessarily the right solutions. Now, in Region 6, where the new private clinic on cataracts is coming out, there's a backlog of cataract surgery. And so this pilot project is supposed to help the backlog. This is supposed to help the backlog. And what happened there is we have to consider that hospital or that health region is doing all the cataract surgery for Health Region 6 and Health Region 5. So maybe the backlog is, maybe there's too many, maybe they shouldn't be doing the Region 5 cataract surgery. Maybe the cataract surgery should be done in the Restigouche area, Health Region 5, at their regional hospital. And we had cataract surgery there before, and it has been taken out temporarily. So rather than go to private clinics and scare people that we're privatizing health care, I think the minister and Vitality should have looked at other solutions, and I don't know if they have. But really, all the equipment, there's ultra-modern equipment at the Campbellton Regional Hospital, and it's not being used. So rather than spend all this money on a new private clinic that you're always going to have a backlog in, if you're taking 2 regions from it, I would say that they should have done that. And at the same time, if we're talking about the regional hospital, they should have had obstetrics returned, pediatrics returned. All of that should come back, Mr. Speaker. Now, I won't keep you much longer. I just want to make sure I have everything that I wanted to mention at this time in place. One other item, and I'm just trying to put my fingers on it. Yeah, it's to get back to the cataract surgery, Mr. Speaker. I'm glad to see that they're addressing the backlog. But like I say, it should have been done in Region 5. Right there now, we have an aging population. The rest of this region, Region 5, Health Region 5, is aging, has the greatest aged population in the province for a health region. And that's creating, obviously, some specific health situations, and one of them is cataract surgery. And that's where the backlog is. So it's not going to stop. It's going to continue. So that's why we should, when you talk about aging, you're talking about people that are in their 80s, 90s. If they have a cataract situation, they can't drive. So they have to go an hour by car. So they have to get someone if they have no family member around, or if the family member happens to be working. If it can't be, usually not their partner, because at that age, the driving is difficult. It's an hour away. Winter roads. We know that the road conditions are not the best. You would know that in your former portfolio, and did an excellent job as transportation minister, and I commend you for that job. So, but an hour away. So they have to, when they get there, they have to eat. You have to leave early in the morning, depending when your appointment is. You have to eat. You have to pay gas to travel with, do your surgery, and come back. So it's a full day. Next thing you have to do is go back the next day for a 2 to 3 minute checkup, just to see if the operation was successful. And that's where I come back to the minister, and I think that he could do that quite easily. Ask them to maybe, and we talked about that before, expand the scope of service for people. Maybe someone other than the ophthalmologist who is needed in surgery, rather than spend a day looking at what happened yesterday, he could be in the surgery doing surgeries, and maybe he does do that. Maybe he'll have someone else at his office. But why couldn't that be done in Campbellton, at least, or with optometrists to look at the results of that surgery and see if there's any indications of issues, and then, if there is, then say, okay, you'll have to go down to your surgeon. So maybe there's something against that, but that's another, what I would call creativity. We have to be more creative in what we do with health care. And one of the things that we have to look at is expanding the scope of practice on a lot of professionals. They've started. I credit this government for starting on the pharmacies, and we pushed for that for many times in opposition. But as far as starting with pharmacies, they've done a good job, but there's more to be done. With the throne speech, there was a mention about shingles, the shingles vaccine, that you wouldn't need a prescription for. And it was so I went to the pharmacy when and it was just that week, and I went to get my shingles vaccine, and they were told, no, you need a prescription. So, and I think maybe it hadn't been transmitted yet or whatever, so I had to go to e-visit, so it would have cost for the e-visit to get a prescription for shingles. So then I went back, and the pharmacy gave me that shingles shot. So there's some lack of communication there. The other thing that I talked to the pharmacists about is the cost of the shingles vaccine. Now, I have insurance, but a lot of people, the working poor, the vulnerable, the aged population, sometimes they don't have health care. And we talk about the surplus. Even this morning in replies to the opposition about the surplus and the need for it and this and that. Well, they could have made sure that the shingles vaccine was free for a certain group of people, you know, under a certain salary. That would be very proactive, and it would be very helpful, Mr. Speaker, and it would be a preventive measure that would save in the long run on the finances. With that, Mr. Speaker, I think I've said my piece, and I thank you for your attentiveness, and certainly I'm looking forward to continuing on other debates this afternoon. Merci. Will Allen.
Government House Leader.
Thank you, Mr. Speaker. I'd like to move to defer third reading of all bills to next Thursday, December 15th. And we'll move to, I'll actually request to revert to government motions for the ordering of the business of the House.
The first thing we need to do is move the adjournment of this debate. So that's it.
I assume that you were looking to adjourn the debate on this motion?
And then defer all third readings to Thursday, December 15th. So there's a motion before the House to adjourn the debate and third reading on Bill 3.
There's a motion before the House to adjourn the debate on Bill 3. All those in favor? It's not a debatable motion.
Oh, that you put closer
All those in favor? All those? Nay. On the. All those opposed? Please say nay. Defer? No. Sergeant, ring the bells. On the motion to adjourn the debate on Bill number 3, all those in favor, please rise.
Mr. Holder, Mr. Savoy, St. John East, Ms. Shepherd, Mr. Fleming, Mr. Fitch, Mr. Holland, Mr. Savoy, Beta Membership Megawatt, Ms. Green, Ms. Dunn, Mr. Crossman, Ms. Johnson, Ms. Yellen, Mr. Hogan, Mr. Austin, Mr. Carr, Mr. Turner, Ms. Wilson, Moncton Southwest, Ms. Wilson, Ormoc, Lincoln, Fredericton, Mr. Collins, Ms. Anderson Mason, Mr. Wetmore, Mr. Ames, Mr. Dawson, Ms. Bacchus, Ms. Conroy.
All those opposed, please rise.
Ms. Yelsnow, Hamilton Dowhausen, Mr. Gauvin, Mr. McKee, Mr. Legacy, Madame Tahill, Mr. Chiasson, Tracquay-Charles, Mr. Chiasson, Victoria-Lavallée, Mr. Coon, Ms. Minton, Mr. LeBlanc, Mr. Lepage, Mr. Bott, Mr. Malay, Mr. Demore, Madame Landry, Ms. Yelsnow, Ken North. That's a total nays, contra 16.
Total yeas, 25, Van Sank. Total nays, 16, says. I declare the motion carried. Revert to government motion for the ordering of the business of the House. Government House Leader.
Thank you, Mr. Speaker. So, doing so, we will now defer third reading of all bills to Thursday, December 15th. That's so that we don't have to say this each and every day. So now that that is done, we are going to proceed to a committee of supply for DTI capital estimates. That's the speech. And then following that, we will open up the supplementary estimates for committee of supply, following which we will then do second reading of Bill 25. Following that, we will then go to economic policy. Thank you, Mr. Speaker.
Call on the member for Front of the Isle, St. John West. Take the chair. The House is now resolved into the Committee of Supply.
I know you're basically. I get it.
It does not say. Is it the pleasure of the committee to take into consideration the estimates for the Department of Transportation and Infrastructure? All those in favour will say yay. Yay. Opposed? Carried. I would now ask the clerk assistant to read the votes.
Capital Estimates 2023-2024, page 21, Department of Transportation and Infrastructure, Bridges, $84,520,000. Highways, $278,650,000. Municipal Designated Highway Program, $20 million. Federal Provincial Cost Share Program, $94,240,000. Vehicle Management Agency, $30 million. Public Works and Infrastructure, $342,951,000. Total to be voted, $778,941,000.
I recognize the Minister of Transportation and Infrastructure.
Thank you, everyone. Yes. Yay. Okay. Thank you. Thank you, Madam Speaker. I appreciate that warm welcome. I am very pleased to rise in the House today to share some information about the 2023-2024 capital budget for the Department of Transportation and Infrastructure. It has been only 8 short weeks since I became the Minister of DTI, and in that time I have quickly learned of the many significant projects that the department has underway. Madam Speaker, right off the top, I want to thank the many dedicated staff who serve New Brunswickers and are committed to delivering solutions to New Brunswickers' many transportation and infrastructure needs. No nerves. It is through their hard work, the diligence of our many contractors, suppliers, and manufacturers, and our partner departments that make the important work that we do even possible. I am proud to serve as the Minister for the Department of Transportation and Infrastructure. Madam Speaker, the capital budget that I am here to discuss with you today demonstrates the department's goal of transparency, accountability, and responsibility in maintaining this province's considerable infrastructure and transportation network. Last year, the department presented the Road Ahead, a 3-year capital asset management investment plan. This has already demonstrated some of the ways that we are changing how our department manages our current transportation infrastructure, as well as how we interact with communities, collaborate with industry, and how we are going to operate into the future. All of this is an effort to provide the best service while staying true to our fiscal realities and responsibilities. Madam Speaker, it is not a secret that New Brunswick is faced with the burdens of aging infrastructure. This annual plan is centered on asset management principles focused on maintaining what we have. Asset management is the key to extending the useful life of DTI infrastructure while minimizing long-term capital spending. Madam Speaker, through this year's capital budget, we demonstrate our commitment to maintaining current infrastructure and continuing to invest in critical components of our infrastructure and transportation network. I'm pleased to announce that this year's capital budget for transportation infrastructure will be $562.8 million. An increase of more than $148 million from 2022-2023. A total of $278.7 million will be invested in New Brunswick's highway network. These funds are used for paving, chip sealing, grading, small culverts, and other highway projects around the province, from large multi-lane highways to smaller arterials and local roads. Madam Speaker, we recognize that our municipalities also are struggling with aging infrastructure. I am pleased to announce that we have increased our funding to the Municipal Designated Highway Program by 1/3 to $20 million. However, Madam Speaker, each year DTI receives approximately $75 million in requests to help fund projects in municipalities, and with the increased investment, the ability to assist our municipal partners with much-needed projects has significantly increased. Madam Speaker, this capital budget also demonstrates our government's ongoing commitment to maintaining key components of our transportation network, and specifically, investing in bridge infrastructure to prolong their useful life. $84.5 million will be invested for the ongoing work on a number of multi-phase, multi-year bridge projects that will continue for 2023-2024. The Centennial Bridge project in Miramichi is ongoing and offers repairs and upgrades to the steel superstructure, rehabilitation of foundation elements, and replacement of the concrete deck and the addition of a new pedestrian access. The multi-year rehabilitation efforts to this iconic structure will extend the service life of the structure another 60 years. The St. John Harbour Bridge Rehabilitation Project, ongoing since 2021, maybe before that, is another multi-year project and one that is scheduled to wrap fully in 2026. The rehabilitation will extend the life of the bridge by 15 to 20 years for expansion joints and deck surface, and another 50 years for bearings. Anderson Bridge, which has spanned across the northwest Miramichi River since 1953. The new bridge is anticipated to open to traffic in the summer of 2024 and have a lifespan of 75 years. Other projects include the Coles Island, keep wishing, the Coles Island Bridges, the Florenceville Bridge Rehabilitation Project, the Mactaquac Approach Channel Bridge, and the Salmon River Bridge in Chipman. Hey. And the Edmundston-Madawaska International Bridge Project that connects New Brunswick to the U.S. of A. These projects, and many, many more that our department is undertaking on our roads, large culverts, and bridges, demonstrate our commitment to safe and efficient movement of people and goods, allows us to support economic development in the province and improve quality of life for our residents. Madam Speaker, at this point, I would like to mention some of the significant projects that did wrap up this year. In St. Martin's, the new Vaughan Creek Covered Bridge was completed in September, becoming the only two-lane covered bridge in New Brunswick. Yes. Maintaining a vital tourism link for what is even more a superb gateway in the beautiful Funday Trail Parkway. And Madam Speaker, when we took power in 2018, we made a commitment that we would restore, re-look after, and reopen our covered bridges in this province. Hear, hear. In October, Fredericton's new Brookside Roundabout opened to traffic. A project made possible with the help of funding under our Capital Highway program. Yes. Now, I do have a special interest in roundabouts myself, Madam Speaker, because I do hail close to the town of Four O's, Oromocto. So if you've noticed, there's 4 O's in Oromocto. There's 4 traffic circles in Oromocto, so we are the town of 4 O's.
Makes sense.
A little bit of trivia there that not too many people know about. Now, where was I? Oh, let's start over. Now, I could go on and on about the hundreds of smaller projects in rural areas of this province as well, including paving, resealing, and minor rehabilitation for routes in every corner of New Brunswick. The work is equally as important to those that travel these roads each and every day. And Madam Speaker, DTI also manages millions of square feet of government-owned buildings. In 2023 and 24, we'll be investing $55.4 million toward the maintenance and improvement of department-owned facilities. As well, $30 million will be invested into vehicle management to purchase important assets such as school buses, snowplows, and fire tankers. However, we do continue to optimize future fleet replacements to incorporate climate change mitigation and GHG reduction through electric, alternative fuel, and related infrastructure. And I know the Minister of Environment will be very thrilled by that. So, Madam Speaker, I think these investments show that we are doing what New Brunswickers expect of us. This includes partnering with the federal government where we can on projects that align with our priorities. By leveraging federal cost-sharing programs, it makes our money go further to address ongoing transportation and infrastructure needs. This year's provincial commitment to federal cost-share projects is more than $94 million. And, Madam Speaker, at DTI, we're working diligently to offer a fiscally responsible capital program in the face of rising costs and inflation. It is no secret that the road building and construction industries are facing unprecedented challenges which impacts much of the work that we are responsible for. We are committed to moving forward in the face of those challenges and ensuring that we continue to address the necessary rehabilitation, capital maintenance, and upgrading of our existing aging infrastructure, and to respond to the challenges of climate change and dealing with adaptation and resiliency. This is a significant capital budget, Madam Speaker, and New Brunswickers should be confident that DTI is managing infrastructure assets responsibly and with a long-term sustainability in mind. We look forward to collaborating with all of you as we forge ahead. Thank you, Madam Speaker.
Pursuant to the orders of the day, on to the next item. Is it the pleasure of the committee to take into consideration supplementary estimates 2022-2023, Volume 1? All in favor shall say yea. Yea. All opposed, nay. Carried. I would now ask the clerk assistant to read the votes.
Supplementary Estimates 2022-2023, Volume 1, page 5, Department of Education and Early Childhood Development, Ordinary Account, Corporate and Other Education Services, $4,450,000. School Districts, $10,870,000. Total to be voted, $15,320,000. Page 8, Ministère de l'Environnement et des Gouvernements locaux, compte ordinaire, Autorisation et conformité, 1 200 000. Services généraux et financement communautaire, 550 000. Sciences et protection de l'environnement, 100 000. Politique, sensibilisation et engagement du public, 150 000. Total à voter, 2 millions. Page 12, Executive Council Office, Ordinary Account, Women's Equality Branch, total to be voted, 480,000. Page 14, Ministère de la Santé, compte ordinaire, Service de santé de la partie 3, total à voter, 81 millions. Page 16, Department of Justice and Public Safety, Ordinary Account, Community Safety Division, $16,817,000. Security and Emergencies Division, $1,800,000. Office of the Attorney General, $500,000. Justice Services Division, $350,000. Total to be voted, $19,461,000. Page 21, Ministère des Ressources naturelles et du Développement de l'énergie, compte ordinaire, Ressources naturelles, $6,600,000. Énergie et mines, 40 millions. Aménagement des terres, 400 000. Total à voter, 47 millions. Page 24, Department of Post-Secondary Education, Training and Labor, Ordinary Account, Apprenticeship and Occupational Certification, $2,400,000. Post-Secondary Affairs, $27 million. Working NB, $27,600,000. Total to be voted, $57 million. Page 27, Ministère du Développement social, compte ordinaire, Service de bien-être à l'enfance et à la jeunesse, 12,100,000. Sécurité du revenu, 11,200,000. Service d'habitation, 15,300,000. Total à voter, 38,600,000. Page 30, Department of Tourism, Heritage and Culture, Ordinary Account, Parks and Trails, $681,000. Culture, Heritage and Sport, $215,000. Tourism, $2,120,000. Total to be voted, $3,016,000. Page 34, ministère des Transports et de l'Infrastructure, compte ordinaire entretien, total à voter 15 935 000. Page 37, Department of Social Development capital account, nursing home services capital improvements, 11,700,000. Public housing capital construction, 1 million. Total to be voted, 12,700,000. Page 39, ministère du Tourisme, du Patrimoine et de la Culture, compte de capital, amélioration des installations, 295 000. Infrastructure stratégique, 3 216 000. Total à voter, 3 511 000. Department of Transportation and Infrastructure capital account, highways, 38 million. A municipal designated highway program, 3,600,000. Federal provincial cost shared program, 19,500,000. Public works and infrastructure, 16 million. Total to be voted, 77,100,000.
I recognize the Minister of Justice and Attorney General.
Thank you, Madam Deputy Speaker. We're here today to deal with the supplementary estimates which have been distributed. General comments I'll make in advance is that the purpose of this is the government must request supplementary estimates to those previously passed for any departments or programs that are projected to overspend in the year in which they were voted. The reason for this is to satisfy the requirements of the Financial Administration Act. That act makes it law that any expenditure of government must be authorized by a vote of the Legislative Assembly. The original estimates were voted and passed. However, increases from those which were unknown and unexpected at the time have resulted in some overages, and accordingly those overages, those excess funds that need to be spent, would be dollars that had not been voted upon by the Legislative Assembly in accordance with the Finance Administration Act. This in-year request is not the norm. Usually government budgets and hopes and plans to come in either on or under budget. Purpose is, of course, to require departments not to incur expenses over and above those funds that have been voted and appropriated to them for the fiscal year in question. However, this is somewhat of an extraordinary year, if not extraordinary times. This year there are total supplementary estimates in the amount of $373 million over 10 departments, including health, social development, and transportation, being the largest of those departments. A proper and legitimate question, which will be asked, no doubt, by my friend from the opposition, will be, so what's with the overspending? Well, that's a good and proper question that deserves to be asked, and a question that I will do my best today with the help of Nick McCann from the Department of Finance and Treasury Board to assist me in that endeavor. Distributed are a booklet entitled Supplementary Estimates. And in this book, as government is required to do, each of the departments which are subject to the overage are listed. The dollars are set out, and beside each expenditure is a short narrative entitled Program Objectives, whereby the background and basis for that overage in expenditure is explained. So in large measure, my answers will be taken to the sections of this document where the expenditures are enumerated, in my judgment, thoroughly and completely, and where a narrative explaining that expenditure is there. Generally speaking, these over expenditures are largely driven by three factors. The first one, which we're all well aware of as we feel it regularly, are brought about by inflation and current market conditions. We all know that things are increasing in cost on a regular basis. We all know that labor costs and labor availability, costs going up, availability tightening. We know that supply chain issues have caused an increase in the cost to move goods, particularly oil prices with respect to transportation, which is an intricate part of the cost of the supply chain. So that is one item. The second item is federal funding for programs that were announced by the federal government after the provincial budget was determined and which the provincial government feel it appropriate to participate. That is the second item, which results in the overages. And the third item for these overages are government initiatives after the budget had been approved to support New Brunswickers with the high cost of living. Examples would be the food and fuel program, which was $20 million, the initiative of NB Power to encourage people to move off of oil, and that's a government contribution to NB Power of $40 million, and includes a climate change initiative of $10 million to encourage people to get off of baseboard electric heating, which is one of the most inefficient forms of heating that there are. So, Madam Deputy Speaker, I hope that these introductory comments provide my colleagues in opposition an understanding of why we were here today. There is nothing overly surprising or extraordinary. It is the proper and legitimate role of government as it does its best to attend to the welfare of its citizenry. It is a legal obligation under the Finance Administration Act that we are here, and in discharging that legal obligation, I hope I have set the background, and I now open the floor to my colleague across for questions. Thank you.
Bathurst West Beresford.
Thank you, Madam Chair. I want to thank the member for the detailed explanation. There's a couple of things that I want to pick up on what he said. He's right. I don't think we're going to have a ton of questions. We understand that inflation was a big part of this year's activities, but still, there's a couple of things we want to just kind of dig in, maybe more clarify than dig, I should say, but just to see, you know, where some of the numbers fall and why sometimes it just doesn't add up to what we hear. And I'm sure there's all very good explanations to everything. First question I would have, just looking in general, I might hop on different subjects, but that's just the way it's presented, so we want to do it that way. In health, just maybe a more detailed explanation of why the 81 million extra. Maybe if we could just go broad, and some of it was just a higher inflationary cost, but if there was anything new on the, very well explained by the minister, there was 3 items that might come up, while anything come up in the other 2 for the 81 million.
Thank you, Member. The 81 million is covered as follows. As you suggested, the portion of it is inflation. Food costs more, fuel costs more, natural gas. It costs more to heat hospitals. It costs more to provide food for the people in hospitals. It costs more money for surgical supplies and the usual expenditures of operating 2 health authorities, which combined have close to a $3 billion budget. The government had an ongoing cost for COVID. A number of assessment centres and testing centres were kept open. It was unsure whether they would have needed to be or not, but there is a bit of an increase, so those items have been kept open. The regional health authorities received $41 million extra or additional in the Canada Health transfers as part of a one-time payment, and those that money has been used for cataract surgery in Bathurst, which the opposition is well familiar with, and for further investment in hip and knee replacement initiatives. That's pretty much what the 81 million is for.
Through the chair, thank you for the answer. Just to clarify, because that was a point I wanted to just verify, the 41 million that had been discussed at a previous update, all of it was spent, or is that still estimated for the end of the year?
The 81 million is the estimated over expenditure for the year. Whether that entire 81 million actually gets spent or not, time will tell, and we won't know that until the end of the fiscal period.
Through the chair, sorry, I might have misspoke. I meant the 41 million for the surgical backlog through the federal program. Is that all spent?
Sorry, I thought you had said 81 instead of 41, but the answer is the same. The 41 is still received. The health authorities are engaged in those initiatives that I did describe, and whether they actually get the entire 41 million spent or not. Again, won't know that until the end of the period. Every effort is made to utilize those funds on the initiatives that I previously described, and there's no shortage of effort. There are shortage of HR and things like that, but certainly not in trying to ensure that as much value from those funds are directed specifically to the delivery of health care, as I had enumerated.
Thank you, through the chair. If that amount is not spent, is there a carryover, or what happens to these funds?
That was unconditional funding. There were no conditions applied to that funding. The initiatives that I described is what the health authorities are focusing on. And if the entire amount is not spent, that amount would revert to the bottom line of the health authorities and would simply affect their profit and loss for the year.
Through the chair, thank you for the answer. Skipping on to another subject, when we talk about government initiatives, you mentioned, for example, the food and fuel, the $20 million. And I'm looking through, I believe it's under social development, and I'm looking through the excess amounts, and I'm just wondering if the minister could point out where that $20 million is, because I don't see any amount that is $20 million. I see anything under there.
You won't see a full 20 million number. If you look to page 26, you will see 38,600,000 under program initiatives, child welfare and youth services, income security and housing services. That's 38. If you go across to the next page, you will see program objectives, which are listed. $12,100,000 at $11.2 million. There are some parts, the funds aren't exactly traced to that. They go into the revenue of the department, and that there are some savings here, there's some overages here, but the actual net amount works out to that which is provided here. But you're correct in that there isn't a $20 million earmarked amount. It's debits and credits, and it finds its way to the bottom item on page 27. Thank you.
Okay, through the chair, thank you. So a reasonable conclusion with that $12,100,000, when there's a $20 million new program, there would have to be a savings of $7,900,000 in other programs. And considering the other points that were brought up, inflation and market conditions and the increasing need, one would reasonably be surprised to see that this number wasn't higher, considering what's the request out there. We've had that discussion before, and I imagine it'll come up again in committee, but I just thank you for pointing out where it is. That gives us a better idea of where to go question the figures. If we go to page 9, on Minister of Environment and Local Governance, it's not a huge amount. It's $2 million overage, but over 25% of it $517,000 is to provide executive management for departmental programs. Can we have a little bit more detail on, is this more VPs, or why such an overage? Because that's not the budget, that's just what's over.
It's interesting having the same question.
And we got the answer.
What it was, Minister Crosman was the minister responsible for environment and climate change and RDC. He's no longer the minister of RDC. Prior to that, his office staff, salary, and everything else was shared between RDC and Environment and Local Government. He is no longer the minister responsible for RDC, so that amount is now entirely captured in that item. So it's not, although it is an increase, it is not new money. Nobody got big raises or hired a whole bunch of staff or anything like that.
So, might I understand that there's an equivalent amount of decrease in RDC? And if so, why the supplementary budget? Wouldn't it just balance out or just make a transfer? Weird answer.
No, there would not, because the government now has a minister responsible solely for RDC, whereas before there was a minister responsible for environment, local government, and RDC. So there isn't a corresponding entry, but this amount, which is there, which you're, I must say, you're sharp to pick it up. Good on you, and. But that's the reason for it, is because the minister does not have two departments, and that sharing between the two is not there. It's all onto one because a new minister was created responsible solely for RDC.
Thank you, Minister, through the chair. And I'm going to be extremely fair here and give the minister a chance to tell us that the Minister of Environment is not making $500,000 a year. Could you give us some details on how many staff are included, what's included in this amount, just to clarify that it seems like a high amount for adding one minister, so is there a department or more staff that were hired? Thank you.
Well, if he was making 517, he'd have bigger problems than from you. So I guarantee you that. He good, but he's not that good. Yeah, included in that number is not just that. It is the salary, allowance, and benefits for the minister, his executive assistant, his executive secretary, and included in that is the deputy minister as well, the deputy executive secretary, and it would be all the expenses of the minister and the deputy minister as well.
Okay, thank you. Good clarification. We saved our minister. He can not have to face a scrum outside to explain his new salary. On page 6 in education, there's an amount for $10,870,000, and it says funding for prescribed instructional programs. Can we just get a brief description of what exactly that entails?
The $10,870,000 is an expenditure given to the school districts for the projected additional expenditures for the $10,870,000, $10,870,000 is money advanced to school districts, and it is for projected additional expenditures for the hiring of more teachers, for new furniture and equipment within the schools, and for the increased cost of fuel for school buses.
Okay, so these, just to be clear, it's instructional programs, but it's not new programs. It's just essentially your first point, which is inflationary pressures on what already existed. There's nothing new.
Correct, but it does include the hiring of additional new teachers. Pardon? Due to enrollment growth. Yeah.
Is that a budgeted item? My understanding is that we have a shortage of teachers right now, shortage of positions. If the position's open, they're not being paid. So is that just a budget line increase, or is it actual salaries paid, anticipated? Because I'm not sure, but if there's a shortage of teachers, probably we're paying either supply teachers or overtime to some other people. I don't know how the department works, but
shortage doesn't mean that you're not going to hire anybody. You may be short 10, but still hire 6, and you're still short 4. So the additional hiring would be for those that were hired. Is there still a shortage? Yes. Are the people that are hired completely alleviate the shortage? No. But increased hirings do have to be reported.
through the chair, so essentially, when you do the budget, is it not based on your needs for the department, not what you currently have? And if you budget for the full amount, then if there's a shortage, you're going to have a surplus. You don't budget for what you have, you budget for what you plan on having during the year. Just opening positions and not having budget for it would be highly, risky.
Yeah, we budget for increased enrollment. With population growth, the increased enrollment has been greater than what was budgeted for. Accordingly, need to hire more teachers. It's pretty much that simple.
Okay, I think, anyway, we'll have a good discussion with the minister at the budget estimates. It's something to discuss further anyway. Back to health. $81 million, I'm just wondering if we have an idea of like how much for there's new funding for the New Brunswick Health Council boards in the explanations, but boards were eliminated, CEO was removed. Shouldn't there have been reduced cost through all that? So why is there an explanation that there's an increase? And actually my understanding is the plan is actually to reduce that board again from the amount of members that we have.
It's a reporting for consistency issue. There is no, the $81 million, there is no money for funding of the New Brunswick Health Council. That description is the same description that is used in the original estimates, so for continuity, that same description is there. It's more like a heading than an actual amount. So there is no funding in the $81 million for the New Brunswick Health Council. It just is referred to there to track the same wording in the original estimates. So the 81 is as I described in your earlier question. But good.
Thank you. Thank you, Minister, through the chair. Skipping ahead, on page 17 for justice and public safety, something we should be comfortable with. There is under policing contract management, there's a surplus of $5,800,000. It administers and oversees the provincial police service agreement between New Brunswick and Canada to ensure effective and efficient provincial and local policing. I guess it's more of a language thing to me, but if it's contract management and it's contractual, why would there be overages? Is this new contracts? Page 17 on it. So it shouldn't be overages if it's contracted. I'm just wondering if there was new programs or something that was added. Why did that come out in the planning when the budget first came out for $6 million?
This overexpenditure is related to the final payout for retroactive pay on the settlement of a contract. So there was a shortfall from what JPS had actually accrued and to what the actual payout was under the contract. To actual.
But estimate to actual, but actually, the first comment was on if you break a contract, we have to pay. So on estimate, we weren't going to break a contract, but in actuality, we did, so it cost us money. Is that what happened, or was that just planned and we just didn't know the amounts of what would come up?
No, it's just the plain settlement of the contract. It estimated that it would be settled at this, and the contract was settled at a higher amount, and that higher amount has to be recorded and disclosed and voted.
Thank you. On page 22, you alluded to the heat pump program as a new program that would be introduced as by government when not planned at the beginning of the year. It's now the $40 million. We've had all kinds of numbers thrown about. I'm really happy. I'm hoping that's the answer we're going to get, that this is finally the right amount, not 400,000 or 20 or 30 or an extra 10. Or my question, though, is we've had a lot of talk, or we had a lot of discussion and a lot of concerns around supply of the material to get this done. Is it the department's feeling that we are going to achieve that for, I believe it's March, to actually get all those heat pumps and that insulation in and actually spend? Or do you have to put it just in case?
Government has been advised by NB Power that $40 million is the number. Remember, NB Power is the delivery agent, not government. Government funds NB Power to carry out and deliver this initiative. So again, NB Power has advised that that is the number and that they target that as being achievable. But again, they're the delivery agent.
Okay. Just make sure they bring invoices before you pay. Just word to the wise. Through the chair, page 25, Petal. There's an amount for $27,600,000, and I believe this is a federal program to provide creative interventions and meaningful services to individuals, employers, and the labor market in order for New Brunswick to have skilled workforce that meets the needs of an evolving labor market. I just want to clarify if that is actually a federal provincial agreement and why the extra $27.6 million. I have a doubt that last year there was an amount that wasn't spent and it carried over in this year's budget, but I'm not, if I could have a response on that.
After we did our budget, that we were advised by the federal government that the money was allowed to be carried over from the previous period. So again, member, good question. It is federal carryover funding.
Thank you. Through the chair. And I read this, I understand this program is essentially to get the workforce, somebody who essentially wants to change professions or move up or upgrade, that there's funds available to this. Can the minister confirm, last summer there was a $3 million donation or amount given to a program in St. John to help underprivileged kids that are living in deep poverty. It was I forget the name of the program, I apologize, but it was last summer. I wonder, is that part of the $27 million? Was that announced?
We don't have the data to confirm that here, but we can get that from the department. We'd have to get that information from them, the program, the funding, and things like that. A member would be happy to do that for you and provide you with that information. You note that. We can speak afterwards, and I will see that you get that information.
I appreciate that, because if actually, and I hear this is a very good program, it's really not a question about the program, but if that program qualifies for this funding, there is a lot of good programs in this province that might also qualify, so I'd like to get the criteria on that. On page 36 and 37, there's some cost overruns on nursing homes. They're absolute figures, very difficult to see when absolute figures are presented. Any idea of what the percentage of that cost overrun would be on the actual budget? Because these might be major, or they might be minor based on the original budget.
This is federal money. It is a federal grant to renovate and upgrade HVAC, heating, ventilation, and air conditioning in nursing homes. 21 nursing homes had been identified by the department as the ones in most need. Again, don't have the list of 21 with me right here, but if the member would like that, would be more than happy to provide him with that.
Through the chair, no. Thank you very much. That was a very concise answer, exactly what I was looking for. General question, last summer or last year, there was an announcement for the New Brunswick Museum for about $8 million to start planning and to do preliminary work. And I know part of that is federal, but where in the budget, where in the, I don't know if it's in the supplemental amounts, because I don't know if it was planned at the beginning of the year, but where would I find it and under what department?
information to date, it would not be in here because it's in RDC's budget. And so whether we're working on getting information in RDC. If you'd like to maybe defer, get that for you later, or wait, we are working on it, but I'll indulge whatever your wish is.
Through the chair, I'd be perfectly fine in getting it later. If I could also get an update if any of the money had actually been spent, or is it just, again, an estimate to get it to the end of the year, but just to see where we're at. If I could get that, I appreciate it. It's going well. I have one final thread of question. It's more what's not on here. We hear that interest rates are going up often. It's a concern that we hear from government all the time, but I don't see extra supplemental amounts for interest on debt for this year's budget. Why is that?
Well, part of it is because the projections for increased interest are accurate, and so there's not an overage. It's not like you planned 4% interest and got 6. What was planned is pretty much what we expected. But in addition to that, the public debt is under budget by about $25 million, so there's savings there. There is higher net earnings on short-term investments, and projected savings in the overall program borrowing. So there isn't any amount because there doesn't need to be any amount because there's no extra spending. So.
Through the chair, I want to thank the minister. Good job. I know he had to do some work on filling in, but good job, and thank you for the response. And thank you, sir, for giving me the right information.
Well, and again, I want to thank the member because thoughtful, intelligent questions certainly make the job easier. The member was only interested in clarification, and his questions were good, thoughtful, pointed, and I appreciate that and thank him for that and congratulate him for it.
If there are any further questions? If there are any final comments other than what was already provided? Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $15,320 to defray the expenses of ordinary account program allocations for the Department of Education and Early Childhood Development for the fiscal year ending the 31st day of March 2023? All those in favor? All those opposed? Carried. Is it the pleasure of the committee that there be granted His Majesty a sum not exceeding $2 million to defray the expenses of ordinary account program allocations for the Department of Environment and Local Government for the fiscal year ending the 31st day of March 2023? All those in favor? All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $480,000 to defray the expenses of ordinary account program allocations of the Executive Council Office for the fiscal year ending the 31st day of March 2023? All those in favor? All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $81 million to defray the expenses of ordinary account program allocations of the Department of Health for the fiscal year ending the 31st day of March 2023? All those in favor? All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $19,467,000 to defray the expenses of ordinary account program allocations of the Department of Justice and Public Safety for the fiscal year ending the 31st day of March 2023? All those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $47 million to defray the expenses of ordinary account program allocations of the Department of Natural Resources and Energy Development for the fiscal year ending the 31st day of March 2023? All those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $57 million to defray the expenses of ordinary account program allocations of the Department of Post-Secondary Education, Training and Labour for the fiscal year ending the 31st day of March 2023? All those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $38,600,000 to defray the expenses of ordinary account program allocations of the Department of Social Development for the fiscal year ending the 31st day of March 2023? All of those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $3,016,000 to defray the expenses of ordinary account program allocations of the Department of Tourism, Heritage and Culture for the fiscal year ending the 31st day of March 2023? All those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $15,935,000 to defray the expenses of ordinary account program allocations of the Department of Transportation and Infrastructure for the fiscal year ending the 31st day of March 2023? All in favour? Yay. All opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $12,700,000 to defray the expenses of capital account program allocations of the Department of Social Development for the fiscal year ending 31st day of March 2023? All in favour? Yay. All opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $3,511,000 to defray the expenses of capital account program allocations of the Department of Tourism, Heritage and Culture for the fiscal year 31st day of March 2023? All those in favour? Yay. All those opposed? Carried. Is it the pleasure of the committee that there be granted to His Majesty a sum not exceeding $77,100,000 to defray the expenses of capital account program allocations of the Department of Transportation and Infrastructure for the fiscal year ending the 31st day of March 2023? All in favour? Yay. All opposed? Carried. Call Mr. Speaker.
Recognize the member for Funding the Isles, St. John West.
Mr. Speaker, the Committee of Supply present a report and ask leave to make further report. Your committee have had under consideration the matters referred to them, have made some progress therein, have passed several items, and ask leave to sit again. Oh, I need a pen.
Are we voting this?
Yeah, your side's on the right.
That's good. The member for Fundy the Isles, St. John West, from the Committee of Supply, presents a report and asks leave to make a further report. Pursuant to Standing Rule 78.2, a motion that the report be concurred in is deemed to be before the House. Is it the pleasure of the House to adopt the motion? All those in favour of the motion, please say yea. Yea. All those opposed, please say nay. In my opinion, the yeas have it. I declare the motion carried.
We were doing bills, third reading bills earlier today. We forgot that last question about these several bills having passed, blah, blah.
Oh, okay.
So I read a little thing.
Members, before we proceed to second reading, we did pass two bills at third reading today, Bills 12 and 20, so I must put the final question. These several bills, having had three separate readings, is it the pleasure of the House that they do now pass? All those in favour of the motion will please say yea. Yea. All those opposed will please say nay. In my opinion, the yeas have it. I declare the motion carried.
Resuming the adjourned debate at second reading of Bill 25.
Resuming the adjourned debate on second reading on Bill 25. Recognize Deputy Kent North.
Merci beaucoup, Monsieur le Président. Au niveau de la deuxième lecture du projet de loi 25, loi concernant la location de locaux d'habitation, c'est vraiment déconcertant de voir l'inaction et le manque de volonté de ce gouvernement de protéger les plus vulnérables avec un plafonnement des loyers. Madame la ministre aime nous répéter qu'ils ont juste à appeler le tribunal sur la location de locaux d'habitation. Je vais vous conter une histoire, Monsieur le Président, dans ma circonscription, de pourquoi ce n'est pas toujours une solution si simple que la ministre aime le laisser paraître. Dans ma circonscription, il y a un locaux d'habitation, un bloc appartement, qui avait 6 appartements. Et puis, le propriétaire a dû aller voir les 6 locataires pour les faire signer un nouveau bail. Le propriétaire n'est pas en faute ici, Monsieur le Président. Le propriétaire, ce qui est arrivé, c'est qu'il voulait vendre son bloc appartement. Il s'est fait duper par l'acheteur et l'agent immobilier. Et donc, il s'est fait dire qu'il devait aller faire signer des nouveaux bails à ses locataires juste pour que la vente ait lieu. C'était juste une question de processus et tout ça. Il n'y avait pas de problème. Et donc, le propriétaire, voulant vendre, il a été voir ses locataires honnêtement. Et il a fait signer un nouveau bail qui se terminait la journée de la vente. Et il s'était fait dire, sur parole, que le nouveau propriétaire re-signerait un nouveau bail avec les locataires. Donc, ayant une bonne relation de confiance avec ses locataires pendant plusieurs années, les locataires ont tout signé, n'ayant rien à craindre parce que le propriétaire avait toujours été un excellent propriétaire, une bonne personne. Maintenant, l'acheteur est une grande corporation ontarienne. Ils n'en ont rien à foutre des locataires néo-brunswickois et de leur bien-être. Ils ont acheté le bloc appartement pour des raisons purement économiques et profitables. Donc, lorsque la vente a eu lieu, légalement, tous les locataires ont pu être clairés. Et la seule manière qu'ils pouvaient rester, c'est s'ils signaient un nouveau bail avec au-dessus de 100% d'augmentation. On a aidé les locataires à rentrer en contact avec le tribunal sur la location de locaux d'habitation que Mme la ministre aime tellement bien dire que c'est la solution et de ne pas s'inquiéter et tout ça. Ils ne pouvaient rien faire à cause qu'il y avait des signatures. Et donc, Mme la ministre continue de protéger les propriétaires malhonnêtes et elle refuse catégoriquement d'aider et de protéger les personnes les plus vulnérables. À court d'arguments, elle cite même à tort des économistes du Nouveau-Brunswick. Ces économistes-là doivent ensuite la reprendre dans ses citations et dire « Vous n'avez pas compris ce que j'ai dit du tout ». Et donc, Monsieur le Président, encore une fois, à cause de les façons de faire, moi, je jugerais ça d'antidémocratique, Monsieur le Président, en fait, de limiter le débat sur des sujets aussi importants de ce gouvernement ici. Je vais devoir déjà m'arrêter parce qu'on nous limite dans les débats de certains projets de loi où le gouvernement n'a pas même le respect de défendre devant cette Assemblée législative ici. Et donc, je pense que c'est assez clair, Monsieur le Président. Ce que je voulais vraiment faire sortir ici dans le débat, c'est que Mme la ministre peut dire autant qu'elle veut que le tribunal est là pour protéger les locataires. Ce n'est pas une solution miracle, ce n'est pas le cas. Il est grand temps que la ministre prenne ses responsabilités et qu'elle protège les locataires de cette province et qu'elle envoie le fardeau au lieu aux propriétaires qui veulent, dans le fond, augmenter des loyers pour la seule et unique raison d'augmenter leurs profits. Merci, Monsieur le Président.
The member for Memramcook-Tantramar.
Thank you, Mr. Speaker, for the opportunity to speak at second reading to Bill 25, an act respecting residential tenancies. And I wish that this act respecting residential tenancies was going to extend the rent cap, ensure there was a rent cap for 2023, because the rent cap has protected tenants this year. It was necessary. The government resisted it for a while and then realized that they had to. It was a tool that had to be used. And unfortunately, it's about to expire, Mr. Speaker. And tenants across the province are worried. They are terrified of what's going to happen if their rent goes up too much. They are worried about not having the ability to pay. There are not enough protections, and there is an imbalance of power in the relationship between landlord and the tenant. Because the landlord, what's at risk for them is different than what's at risk for a tenant. The tenant risks losing their housing, Mr. Speaker. There is a power imbalance. And yes, they're being told to go to the Residential Tenancies Tribunal, and many of them do. And I recommend people go there regularly. I contact the Residential Tenancies Tribunal myself and let them know about what's happening in my riding and in other places. I hear from people across the province who are getting notice of rent increases that at this point are legal of significant amounts. And Mr. Speaker, it's almost as if the minister responsible for housing wanted to have a rent cap. Like there was a move towards it, but that she wasn't allowed to have one. They're talking about spreading the rent increase over several years. But, Mr. Speaker, what does that look like if you have a 75% increase in rent, so 25% a year? Like, Mr. Speaker, this is not acceptable. And one of the issues is that there's this, they call it, I guess, in the industry, like turns. When someone leaves a unit and a new person comes in, the rent can get raised however much the landlord wants, and that's creating upward pressure on the price of rentals. And so even to compare in a geographical area, well, we know, Mr. Speaker, that the prices have gone up across the board, that is not enough protection. This legislation does not go far enough. It is not good enough. It will not protect the most vulnerable, the people that need protection. And Mr. Speaker, we have to understand that many people are, as I said, there's a power imbalance. Many people can be intimidated by the process of navigating going to the Residential Tenancies Tribunal. They may have had bad experiences dealing with government agencies in the past. I see that on a regular basis. And they may be intimidated, there may be literacy issues, there may be other issues. And so to put the onus on the tenants to say you need to keep fighting, you need to keep fighting to have somewhere affordable to live constantly, rather than putting it on the landlords to have to justify increases, to have to justify renovations, to have to justify that the tenant should even have to move out for a renovation, to justify increasing the rent, because it's becoming unaffordable for so many people. This is serious, Mr. Speaker. And the market conditions that the government finally decided warranted having a rent cap have not gotten better for tenants, Mr. Speaker. I would argue things are worse because the cost of food has kept rising, the cost of people putting fuel in, whether it's their oil tank or their gas tank, that has gone up. It is more difficult for people to get by. And they are going along, many people without a livable wage, many people without paid sick days, even though we're still in a pandemic. I don't know how people are doing it, Mr. Speaker, where their kids are out sick and they need to stay home and miss work, and they're wondering, how am I going to pay for my rent? And they're getting notice that they're going to have a significant rent increase, and they don't know what they're going to do. Mr. Speaker, that is the situation for people, many people in New Brunswick. And it is clear from the actions of this government that they could not care less, that they are not willing to do what it takes to help the people of New Brunswick. What are they going to do? Well, they're certainly not going to provide a rent cap to prevent people from losing their housing. They're not going to ensure that people can afford food and gas. They're not going to take the millions and millions, the hundreds of millions in surplus and put it where it needs to go, Mr. Speaker. And so here we have inadequate legislation that is being debated with a time limit. Because, Mr. Speaker, there is a motion that the government has tabled to limit the debate on several bills, including this one. And it is unacceptable. It's indefensible. This is ridiculous. And they might say, oh, well, the Liberals did it. Well, that doesn't make it right, Mr. Speaker. To be limiting debate on important legislation. Why rush these things through? And I could get into the need for proportional representation as well, Mr. Speaker, because they're able to do that, because they have 100% of the power, nowhere near 100% of the votes, Mr. Speaker. But here we are with debate being limited. And so we see the debate is being stifled. What does this mean for our democracy? That members of this House, who should have every right to stand up for the tenants of this province, for the people who need protection, but they're self-censoring, they're limiting, they're looking at the clock like I am now, saying, well, gosh, if I keep talking now, maybe I won't be able to ask the minister questions and try to get some answers to defend the legislation that they're trying to push through. And I asked questions in committee previously, and we don't always even get the answers. And we should be able to call witnesses, Mr. Speaker, and I'll bring that up again, because we can't always get the answers from the ministers, Mr. Speaker. We need to hear from experts as well. So, Mr. Speaker, it is a sad day for democracy in this legislature, in this province, because this is an unacceptable way to run things, to push things through and to limit debate. And so, as I've said, I guess I should save some time for committee so we can try to get some answers, try to get some justification for some of these bills that they're trying to push through. Thank you, Mr. Speaker.
Are there any other speakers? That's Bill 25. It's the pleasure of the House that Bill number 25 be now read a second time. All those in favour of the motion, please say yea. Yea. All those opposed, please say nay. Nay. In my opinion, the yeas have it. I declare the motion carried.
An act respecting residential tenancies.
Pursuant to Standing Rule 42.1, Bill number 25 stands referred to the Standing Committee on Economic Policy. Government House Leader.
As per the orders of the day, Mr. Speaker, we'll now move to economic policy, so I move the adjournment of the House.
Government House Leader moves the adjournment of the House. All those in favour of the motion, please say yea. Yea. All those opposed, please say nay. In my opinion, the yeas have it. I declare the motion carried. The House is now adjourned.
Good speaking.
Yeah.